Okay, we're live, Chair.
Thank you, Borough Pawb Croeso. Welcome to the Health and Social Care Scrutiny Committee. We've got one main area of questioning today, which will be on the social care budgets for both adults and children's. But just before we get on to those items, Connor, have we got any apologies, please?
Yes, Chair. Apologies received from Councillors Liz Reinenberg, Josie Ewing, Benjamin Breeze, and then Councillor Little-Brickhouse has given tentative apologies due to other council business. And then from officers, Emma Palmer, Chief Executive, and Gavin Williams, Senior Manager, Care and Support.
Okay, thank you. Anybody got any declarations of interest? If anybody has close family working in either of these sectors, or has a family in that may be impacted by any of the cost efficiencies. I'm thinking of things like changes to direct payments, day opportunities. No. Okay, any disclosure of party whips? No. Connor, I'm going to move minutes and action log to the end of the meeting, if that's okay.
Yes, Chair.
And then our main item is to go through the draft budget. And first of all, we're going to look at the children's budget. And so on that note, I'm going to hand over to officers and the portfolio holders. I'd like to welcome Councillor Sandra Davis, Councillor David Thomas to Scrutiny today. Thank you very much for coming. And then we have all of the senior officers. We've got Nina, Sharon Powell and Jackie Pugh all here to talk us through the budget. So who's going to lead, and are you going to want to share your screen to show us some slides?
Borough Councillor Amanda, and welcome everybody to the Children's Services budget this morning. I'm hoping that Connor's going to be able to share the slides that I sent over to him recently. So if that's helpful, I'll allow and enable Connor to do that while I just give a bit of an overview in terms of children's services. So in terms of children's services and our vision hasn't changed in terms of the forecast for the next 12 months. So we have three key areas that sit within our integrated business plan. That is around looking at right help at the right time. So this encompasses all the work that we do in terms of intervention and prevention. It looks at all our early help services. It looks at then that kind of front door service and through into our assessment service. So for this, we're still very much building on all the things that we've delivered on in the last 12 months. So you'll be aware that we've got a family centre in Welshpool and a family centre in Newtown, and the plan is very much to roll that out across the county, looking at Ystrad as our first port of call, and then building on that through Brecon and through Landrindod. We very much want to build all the areas that kind of interconnect with Flying Start and really give families the opportunity to receive intervention at the earliest possible time, with the view of preventing them needing to come into any element of the statutory service. So that's a really key focus for us. We still have our strengths-based approach, which kind of encompasses all of that work, and we still use signs of safety as the backbone to our framework. So that's very much looking at what is working well, what are we worried about, and what are our next steps. And using that framework, it's a way in which we can analyse, assess, consider, reflect upon every aspect of the service as we kind of deliver it over that 12-month period. So we're going to continue to use that framework and that approach over this next financial year. In terms of the second element of our integrated business plan, this is around closer to home. And this is where, when we come to talk about a budget position, is where some of those pressures and efficiencies, etc., kind of emerge. So with our closer to home, what we're trying to aim to do is to keep children living at home, living with their families, living in their local communities. But where that isn't a possibility, and where maybe those risks are significant, we then have to make difficult decisions in terms of where that child lives. So that child may live in a foster family, they may live with a connected person to their family, they may have to live in a residential home, and they may have to live outside of Powys, outside of Wales, in a placement wherever that is sourced within the United Kingdom. So that's one area that we're still working on in terms of bringing children back into Powys, bringing children back into our own provisions, and that remains the kind of at the forefront of all the work that we're doing. And you'll see through some of the budget positions, some of the complicating factors that kind of sit around that have emerged over the past years, and some of the things that we're working on in order to take steps to improve things. And then the third element of our integrated business plan is around creating a sustainable and supported workforce. So again, you will be aware about our Grow Our Own project, that we've really invested in trying and enabling staff within our own workforce or within the council to kind of engage on a social work degree programme and to upskill staff as much as is possible to enable them to embark on their training in terms of social work training, with the view that in 2 to 3 years' time, that will enable us to have less agency social workers within the system. So over this last 12 months, we have seen a decrease in the amount of agency workers that we've had. And over the next 12 months, the forecast is, with the cohort of students coming through, that continuation of reducing our agency workers and growing our own social workers will increase. That invariably comes with a cost, and that will again be kind of evident in the budget position in terms of where we're at and what the next steps are around that. As well as kind of creating the Grow Our Own, it's also about supporting the workforce. So we are very much committed to and motivated to supporting our workforce, and that's really fundamental in not only the Grow Our Own project, but also looking about the future of Powys and looking at the future and the sustainability of children's services. We need a stable and supported workforce in order to deliver all the outcomes that we are focusing on through our integrated business plan. So well-being is a really key focus for us. It's really important that staff have opportunities to reflect upon practice, to enable them to have supervision and individual appraisals, as well as the kind of collective vision of the whole of children's services. So I just wanted to kind of set the kind of scene really in terms of the vision of what we're trying to achieve and how we're trying to get there. So Connor, if you could move on to the next slide, that would be helpful. Okay, so in terms of the base budget, I'm not going to read everything verbatim off the slides because you can actually see that, but the base budget is 29.482. You'll see the pressures are 2.336, and that includes that inflation in terms of other costs, totaling 801,000, which we'll come on to in more detail as we go through the presentation.
Sharon, sorry, can I just stop you there? I'm getting the next slide as well. Can Connor just adjust it so we just see the slideshow, please?
Oh yeah, it's on the side. Why is it showing it like that? So
doesn't normally do this. Sorry, bear with me.
No.
Well, if you can't leave it as it is, but
It normally doesn't do this view.
It's like it's got a panel view.
Is that?
Oh, there we go.
Yeah.
Well done.
Thank you. Sorry.
Hey, Sharon.
Okay, so we talked a little bit about that in terms of the base budget, the pressures, and then inflation in terms of the amounts there. So if you go on to the next slide, Connor, please. So here we have our pressures. So you will see that there's lines in terms of what the specificness relates to. And then on the right-hand side, you'll see the actual figures that amounts to. And I'll take you through these, and then Jackie will come in as well if needed to explain anything. So in terms of one of the biggest pressures that we've kind of had over the last 12 months, and which is a growing pressure for us, is the requirements for the local authority, and it's the requirements for every local authority in the UK to be able to support and care for, as corporate parents, our unaccompanied asylum-seeking children. So you'll be aware that the pressures on UK borders, particularly in Kent, where numbers are increasing and rising, more so in the summer months than in the winter months, due to kind of the impact of crossing the channel. But nevertheless, those numbers are continuing to increase. As a result of those numbers of young people coming into the border areas, Kent have the responsibility of initially processing all those young people, and then through a national referral mechanism, which is set out by UK government, every local authority has to receive, under legislation, children that fit into this category of being unaccompanied asylum-seeking children. So they are children. They're all under the age of 18. And when they come into the UK, there's a process that happens in order to, make sure that their well-being is absolutely okay, but also that there's an age assessment test so that we can actually work out as best as we possibly can how old that child is. Often they travel without documentation, and they've often had horrendous journeys to actually cross the continent to actually get into Britain at that Kent border. So we have seen an increase in the number of young people that we care for, and that projection and trajectory of that increase is likely to continue into this next year. The challenges for us are we can't always predict necessarily how many extra additional young people we'll be asked to take, but we do have a percentage which is calculated. So we know that roughly that percentage, so we know roughly how many children we're going to get, but we don't have the option of actually not receiving children until we reach the maximum of our percentage. So this last 12 months, we actually started the year with a relatively low number, but by Q3, we've actually reached the capacity of the numbers in which we are asked to care for. So that in itself has created additional pressures for us over this last 12 months, but also the forecast going into next year, also that continuation of that pressure exists. So you will see that that then impacts on staffing in terms of having additional staffing to be able to support these young people. And these young people, some of them live in Powys, some of them live in our foster care placements, some of them live in our 16+ provision. Some of them live outside of Powys in residential care, and some of them live in the cities. So there's a whole wide range of needs, there's a whole wide range of complexity. And in order to meet those needs, we need to be able to have a variety of opportunities and placements in order to care for those individual children and make sure they have the best possible outcomes. So the one line is around staffing. The next line is around placements. So you will see that it's placements under 18. So there are 23 placements as per the Home Office allocation, as I've described. And then you will see that there are placements post 18. What the post-18 element means that we have a statutory duty as corporate parents to look after any child up until their age 25. And with unaccompanied asylum-seeking children, that is absolutely what that statutory requirement says. So there are costs post-18. And if you think about, where does that child live when they're 18? Are they able to get into employment or training or education or housing? All those things become very complicated, not only because of their lived experience and their traveling situation and getting into the UK, but it's about thinking about where do they settle, where do they want to invest their time and energy, and consider all their cultural and ethnicity needs as part of that. So that has become something that we're very invested in committing to. And here in Powys, over this last 12 months, a lot of work has happened in terms of looking at that kind of elements around different language, different food, different ethnicity issues, and the religious elements. So we are making lots of changes internally within Powys from where we were in the previous year, but we've still got much to do in terms of growing that. What we want to do is to try and keep as many of these young people in Powys, because that fits much more for us in terms of closer to home, in terms of overarching strategy, but it's also around ensuring that we give these young people the best maximum opportunity and outcome to be as successful as they possibly can. And that's easier for us to kind of work with if we have young people local to us, where we have much more effective relationships with schools, with training, with housing, etc., etc. So it's kind of a pressure. It is a growing pressure, but it's also something that we're also looking at creatively in terms of what our next steps are. Some of that is around growing our own provision, like I said. So we're working in collaboration with housing and training and lots of other officers within the council in terms of how we can kind of just strengthen that outcome for those young people. But invariably on our budget, it is a pressure because of the challenges in which I've explained. In terms of placements as a whole is a really national problem. There is a shortage of foster care placements. There is a shortage of residential placements, and this invariably has an impact not only on demand, but it is a marketplace where actually some residential placements, for example, can charge what they've and increase their charges because they're aware of a national shortage of placements. So when you think about the not-for-profit agenda, which is set down by Welsh Government, the actual value base behind not-for-profit is absolutely the right thing to do, because what it's trying to do is to drive provision to be a not-for-profit making organisation in terms of reducing costs for children and local authorities, but actually it's the right thing to do in terms of making sure that children receive the best possible care that they can. But why should we actually be paying more and creating a kind of industry where there's a profit-making opportunity because of the lack of available placements? So we're absolutely signed up to the not-for-profit agenda. However, because of the market, that creates problems for us in terms of placements. So when we're looking for a placement, whether it's in a foster care placement, so that could be an independent fostering agency that may sit in Powys, may sit in Wales, or where we're looking for a residential placement, those costs can astronomically go up. What we can't predict always is what that cost is going to be, because we can't always predict when a child is going to need the provision it needs at that time. So therefore, we're very much kind of in that marketplace then, looking, searching, identifying placements, and cost obviously is a big factor in terms of that. So that, in effect, what we've determined is going to be an ongoing pressure for us. Not only has it been a pressure for us this year, it's going to be an ongoing pressure for us next year. And that sort of effect then has an impact on those children coming into placement, but it also has an impact on those children who will become care leavers post-18. So in the same way I described that in terms of our unaccompanied asylum-seeking children when they become care leavers, it's the same for care leavers as a whole. You support those young people up to the age of 25, depending on whether they're living independently, depending on whether they remain in their foster family, which is called When I'm Ready, and whether they access training, education, go to university. Those, again, are ongoing costs, which sometimes you can predict, but sometimes you can't predict. So it's very much about individual needs, individual complexity. But what we do know from the budget position over recent years is those pressures can emerge, and these are the pressures that we've identified to date on the knowledge that we have that we're forecasting for next year. In terms of savings, so we put together last year, obviously quite a big kind of forward-thinking sort of can't think of my word, forward-thinking kind of plan really around what we wanted to achieve and where we wanted to achieve our savings on. A lot of those savings were attached to our 16+ provision, which we've actually met 3/4 of that, and placements, which we know are our biggest area of spend. And some of those placements can cost upwards of £4,000 a week. Some of our most expensive placements are sitting at £10,000 a week. And what sometimes you can't predict is that need of when you're going to need that placement based on the complexity of that child. So we have had some situations over the past year where children have needed that very high-end level of support, and that comes with the cost. So we have had some children that have been in upwards of over £10,000 a week placement situations. And sometimes we can't just predict that because we don't know what's going to happen. We don't know what child and which child is going to need what at what particular time. So some of the savings yet to be delivered relate to placement. But since we put these slides together, our Q3 performance has actually improved. So there will be some adjustment in terms of navigating through the budget over the coming months as we move into Q4. So we may not be in a position that we can completely deliver on all those savings, but that element there will reduce as we work through Q4, and it will be reduced from that 955 that it's said there. In terms of short break provision, short breaks has remained kind of very similar, I guess, in the sense of what we've delivered, when we're delivering it, and how we delivered it. So there has been an increase in short break provision since initially the global pandemic and then afterwards. And so what we need to do is kind of just reflect on short break provision. We need to look at what are we providing? Where are we providing? How are we providing that? And so there will be some ongoing work around short break provision, as there will be with direct payments over this next 12 months. In terms of the current pressures, those are the identified pressures that we're aware of based on that increase in demand for short break provision. We've talked a little bit earlier about the real living wage, but for us in terms of uplifts, etc., you can see the pressure there that equates to that across on that line. In terms of in-house residential, a bit about, like I spoke to you about the complexity of children, what we found is we are growing our in-house residential provision. And because of the lack of national placements, we've then had to have more complex children living in our residential care. That's absolutely the right thing to do. It's absolutely the right thing to keep children in Powys, and it's absolutely the right thing for us to be able to support that child in those circumstances. What the challenge is, however, with that is we've had to need additional staff in order to deliver an effective care plan. So whilst that's really important that that child has that opportunity and that outcome, it does come with additional costs when we're having to wrap around additional staff around that particular child in that particular way at that particular time. In terms of our residential homes as a whole, we were using one of our homes for a really complex young person, and those circumstances changed into a different trajectory. So whilst that child moved on, what we did, we took a decision that we actually put a hold on to that particular home at this particular time, and we deployed the staff from that home to some of our other homes to prevent us using additional agency staff at that time. It doesn't mean to say we're not going to revisit and reopen that home, but it just gave us an opportunity to press pause, to just slow things down, to just looking at our structure around our residential homes, look at the qualitative approach around the delivery of the model of care that we want to provide, and actually use the staff that we've got to supplement the other homes to prevent that need of agency staff. So it is a temporary measure currently, and it's a project that we're kind of looking at in terms of next steps. In terms of early help, in terms of post-pandemic, we are well aware that families need us more at that early help stage. And whilst as a whole, we've invested a lot of additional resources into early help in terms of budget, staff, model, concept, etc., there is a continuation of increased demand. That's a positive thing, because what we want to do is to provide that early intervention and prevention at the right time in the right way, like I indicated around our aspect of our integrated business plan. So whilst that has become a pressure because that demand has grown there, and it is something we're looking at in terms of how we can meet that demand and it not become a budgetary pressure. So we're looking at how we can kind of mobilize things in a slightly different way, or access grants in a different way, or just look at that service as a whole, really, as a next step. Connor, would you like to take me forward, please? So pressures, as I said, we're holding at risk and not requesting funding for at the moment, are around demography. And I'm sure we'll come on to talking about demography when we come to questions in terms of that. And Jackie will be able to explain to you exactly what the impact of that is and what that actually means. But this is where we are looking at our cohort of children that exist currently within our demography, and then talking to you about how we can't always predict what child is kind of going to need when they're going to need it over the forecasting year. So this is based on sort of predictions of what we know from what has happened in the past, but sometimes we can't always predict it entirely because we don't know what family's going to need what in where. Again, in terms of the demography around a disability service, that goes back to that kind of direct payments, that short break. So we can predict that a little bit more because we're aware of some of those needs there because those children are already with us. But what we can't predict is any new assessment that might emerge that we're not aware of. So again, there's a whole kind of columns there around demography. And then we have had some of our workforce have been employed by Powys County Council, some for considerable lengths of time, but we've also been using a social care workforce grant to supplement that payment of some staff. And we weren't aware whether that actual social care workforce grant was going to actually materialise or not, given the constraints of the budget Welsh Government, but we do actually know now that grant is coming through, although I'm sure Jackie will correct me, but it's something like a 22% decrease in that budget in terms of what we have been receiving in the past. So therefore that will have an impact in terms of some of those post across children's and adult services. However, we have met, and that pressure there put forward there is going to be much less pressure. And now that we know that we have got the grant, and actually we're looking at how we can mobilise that grant across both services to be as effective as possible. So take me forward, Connor.
So I think what we're going to do now, Sharon, is if we're going to have, pause it. If we can go back to the first pressures slide, and we might come on to the pressures hold at risk slide as well. But I think if we're going to have questions on that, just a couple of questions that you might want to just go away and get a couple of numbers from me, whilst other people are asking questions too, is on the unaccompanied asylum seeking children, the placements post 18. Do you know how many children that relates to? Young people, I should say. They're over 18. And also on the full year effect on leaving care of children turning 18 this year, the 486, how many children are turning 18 this year? So that's sort of two questions just to sort of go and look away with. So councillors, I know some of you've got questions on this. Gareth, did you want to, Sandra, sorry, did you want to just come in before we start asking questions?
Yes, thank you. I'd like to thank Sharon for presenting the information here, and obviously we have discussed everything. I just wanted to say, in relation to your question, Councillor Amanda, one of the issues that we do have when these youngsters arrive on the ports, on our shores rather, we have no idea what age they are. We don't know anything about them. So for you to ask how many we might have in the year, I know we can look at the ages of the youngsters we've got already.
Yeah,
and we can
I think that's what I'm looking for.
Right, okay, thank you, because I was going to say, we could have 18-year-olds arriving and we still have to provide for those. So we might have them 21 years and older and we still have to provide for them. Those are the ones we don't know. So I just wanted to put that into the mix. Thank you.
That's fine. I guess though my question is, we've somehow had to calculate that 393,331. So if we don't know their ages, how have we done that calculation? So that's my my question.
I can come in there.
Okay.
But we obviously do this at a point in time, and we knew at that point in time that we'd got 21 children allocated to us under 18. 13 of those will be attaining the age of 18 during the year. So we've done a calculation based on their dates of birth, when they'll be 18, what their current costs are, and we've assumed that some of those, it's a modelling cost, will be actually moving into the supported living, the houses of multiple occupancy.
Okay, so that 393 isn't then predicting children that will come in that we don't know of yet, is it not?
No, we know who's turning 18. our allocation is the cap up to 23 places of children under 18.
Okay.
And
So
that's the cap that's been allocated at the present moment. Obviously, the Home Office are looking at that cap, and it may be revised.
so all of those figures, the 393, the 309, and the 99, are based on you being at the top of that percentage of being with the 23 children.
The 99K is around the extra workforce that we require. The 308 is a modelled cost on bringing the number under 18 up to 23 placements on an average cost, but obviously until they present, we don't know the actual cost. And then the 393 is some 18-year-olds that are currently in the system, which are causing the pressure, but also the 13 moving across, and modelling in if we have the supported living properties as well during the next 12 months.
Okay, so but just to sort of work out how that looks per child, that's over £700,000 worth of pressures, and that's on over above, because the money you're getting from the Home Office doesn't cover the costs. And if you divide that by 23 children, we're looking at.
But we won't have 23, will we? The cap is 23 up to the age of 18, but once they become 18,
we get another lot in.
Once they become 18, their hours until they're 25, they're not part of the cap.
If so, once they're 18,
we know that will we then
get more? We can potentially get more children under 18.
Yes.
I see.
And then that's where you can't predict the age. So you could have some that are 17 that then might turn 18 quite quickly.
That year.
Or you might have, we haven't had anybody younger than 14 yet.
Okay.
So it's generally that sort of 16 to 18 is largely where the cohort of young people are.
Okay, I think the point I'm making is it's a very high cost per child, and I'm going to come on to questions on and I know you've explained some of this previously to Scrutiny, but I'm going to come on to questions on that in a second.
But in this year's accounts already up to Q3, we've got over 300k pressure in association to these cohort of children at the present moment, before we ever move into next year.
Yeah, no, I understand that. I'm just going to mull that over. I know I've asked a question on how many children are turning 18 this year in relation to the 486, but before you come back to that, I think I'm going to hand over to Councillor Gareth, because he's had his hand up for some time.
Thank you, Chair. My question's on the unaccompanied asylum seekers as well, but for future years, 25, 26 onwards, am I right in saying that we've allowed for the expected growth in 24, 25, but limited additional growth in the next 4 years?
That's correct. And I think that's probably down to my lack of knowledge at the time, and we will need to remodel.
So what we're saying, there could be some significant additional pressures, budget pressures in 25, 26 onwards.
There could be, but we don't know. I think we'll have to use the following 24, 25 year as a learning year, and see how the houses and the support that is required pans out.
Yes, but if we got 13 that are turning 18 in 24, 25, Sharon said that the youngest we get is 14. You got 23 children. That's going to be around about 7 children per year group. So there's going to be pressures coming through until they start tipping out at the top end, don't they?
Yeah.
Okay.
Yeah, that's right, Councillor Gareth. That's right.
Yeah. Okay.
So that's why we're looking at a different sort of model in terms of developing our own provision in Powys. So we're working with housing. We've just been allocated for houses in terms of just looking at how we can kind of develop that provision internally rather than having to source external provision at a higher cost.
Yeah, I understand that, but at the moment we have got an unknown potential pressure for
Yeah.
following years. Can I just go on to ask a question about the next line, the placements? In the budget papers, there's a 600,000 pressure in 24-25. That then turns into a £500,000 saving for each of the next 4 years. How certain are we that that 2 million saving can be made?
That's a big question, really. And I think that's one of the challenges. And it's one of the risks also, in that you can't necessarily always predict any child's individual needs at any particular time. So obviously Jackie works on that moment in time in terms of the children that we have within, in terms of being looked after right now. But however, sometimes you can't predict that, which is why that's become a pressure from this last 12 months going forward, in terms of not being able to make all of the savings for this next year. So yeah, it is a challenge and it is a risk, and it's something we can't always predict, Councillor Gareth.
Okay, thank you.
Councillor Chris.
Thank you, Chair, and thank you for the presentation so far. I just wanted to ask, again, it's with the unaccompanied children, the under 18s. Are you saying then that you just get this fixed amount of money that comes through, and once you've assessed that child's needs, there is no additional funding that will then be released on the, and do we always have 23 placements, or do we have less children than 23, so the 309,000 that is in there is available for those children, and some children may take more of that pot of money than others?
Yeah, it's a really good question, Councillor Chris. I think in terms of the calculations that the Home Office through the National Referral Scheme allocate to Powys, the number is 23. So at the start of last year, we were much less than that. And over 2023, that figure has reached its maximum in terms of 23 children right now. They are, like Jackie said, reviewing that calculation. So there is a view that that could go up for every local authority. And I'm anticipating that may well be the case for us. Once you reach 23, you can actually say, we can't take any more young people. So we've got the ability to say no to that. They do ask, are you in a position, can you take more? But we've kind of held the position that once we've reached the top of our cap, we're not in a position to be able to offer any further placements. In terms of the question you raised about cost versus complexity and need, therein lies the real challenge. So we don't know those young people until they arrive with us. They get a very brief assessment in Kent, and then we follow that up with more assessments once they reach our care. And therein lies the challenge. Some young people require very minimum needs in terms of a support plan, whilst others have required a lot more intervention, a lot more specific intervention, and have required to maybe live in a residential setting. And therein lies the cost implications, very similar to our own children looked after and looking at children looked after as a whole. Sometimes the complexity increases so much that you're then having to source provision that is very costly. So we won't know that until we've actually assessed that individual in terms of their own circumstances, which is why it's then very unpredictable in terms of being able to predict it in the first place.
But there's no potential of going back and saying, once we've seen a child, that child's needs are going to be greater than, because based on 23 on there, that's about 14,000 a child. If you then have got to say that that child's placement would be outside of Powys, in a different location, because the health needs of that child need to be addressed by a centre or a district hospital with more expertise in a particular condition or illness, and that could just be really opening us up to a huge amount of potential cost with no form of review on that child's complexity of needs. And that seems a little bit unfair, because it's really like a lottery, isn't it? Of a child comes in and then they've got huge amount of need, which then puts cost on the community of Powys then to be able to pick that up, where realistically this should have some more central funding coming through. Or have I got it wrong?
No, that you're absolutely right. In terms of the allocation, once you're allocated your child, the local authority is then legally responsible as a corporate parent for that child. So you can't then refuse to have that child, because then you're legally obliged as a corporate parent to have that child once you're allocated that child. So you can't, no local authority is able to kind of
Sharon, just to interject, I don't think that's quite the question Chris is asking. I think it's more that to do with the lines of communication once we have that. I don't think he's saying that we should refuse to. I think it's more to do with, are there any conversations had between us and our contacts at the Home Office
exactly right,
to feedback the cost differences?
Because you can pick up a child that yes, we have a corporate responsibility for, and I have no problem with that, because that's the right and proper thing to do. However, if we've got based on 23, it's working out at approximately £14,000 per child. But when you've assessed that child's health needs, that child's health needs could be 150,000 if you need specialist intervention, etc. And for me, it's, where does that then go? Or do we just accept it? If we're accepting it, I think that should be challenged, because I think then there is the complexity argument is putting additional cost pressures on your service, which then impacts on how we deliver other services, because if we're having to move it from different parts of our budget to deliver for that particular child, that seems a little bit unfair, and there needs to be a reassessment process going back through the Home Office or the various agencies involved.
Can I just also add to that as well, Chris, for you both just to consider, is there any kinds of conversations with the Home Office in terms of what we are able to accommodate here due to the fact we don't have a district hospital? So yes, we still accept the fact that we've got a percentage provision that we're responsible for, but actually on a practical basis, if we have a child that comes with a significant health need and so needs to be placed out of counties where they're near to those resources, it would be better if we had a different child instead of that, and that child was placed in Liverpool, for example, where they could have those resources. Do those conversations take place with the Home Office?
Yes, I mean, they do. So there is an element of that in terms of that discussion through the national referral mechanism around what needs Kent will have assessed at that particular time. So those conversations do happen at that point of time. But you've also, which I haven't stated, is you have a 5-day window of turnaround in terms of when you get allocated. So you'll receive your referral and you have to place that child legally within 5 days. So unless there's a specific need that's already emerged, that's been assessed by Kent within that very early stage, then you may not actually know those competing demands or needs until you go through your own assessment process. So that is a challenge. But and I know Lynette wants to come in, so she may well want to add some narrative. But just for assurance, in terms of the mechanisms of discussion, all local authorities have this very similar complicating factor as we're talking about today. Through the All Wales Heads of Children's Services, this matter gets discussed and raised through that mechanism, and that feeds directly back into Welsh Government. There are working groups across Wales that particularly look at that and particularly feed back to Welsh Government. I'm sure ADSS Cymru also talk about this matter and feed that back to Welsh Government, so that there is challenge that happens in terms of the implications on budget and the implications on capacity and demand through those kind of mechanisms. But I think I'll let Lynette come in because she may want to add some further information.
Thanks, Sharon. Hi, Lynette.
Hi, thank you, Chair. Yeah, I just wanted to come in just to say that obviously we as a Powys Local Authority belong to a regional safeguarding board called CASIR, and this is an issue, as Sharon has already said, across the whole country, but certainly as a region, that's Carmarthenshire, Powys, Ceredigion and Pembrokeshire. This is on the agenda at the regional safeguarding board as looking at a joint working and how we can work together more effectively, and indeed make representations to the Home Office, etc., together as a joint region. So just to assure the committee that there are those representations being made, not just from us, but from the region, as well as from the whole of Wales as part of the the heads of service meeting, and indeed the directors meeting, around the pressures this puts on local authorities. So those representations, Chair, are being made across the country.
And do you get a sense, both that even outside of Wales, in rural parts of England, that counties have similar issues?
So,
Yes.
Yeah,
I would say so. Sorry, Lynette.
No, that's fine. No, I was going to say the same, Sharon, and just say that, you know, they do, and certainly with CASIR, with the 4 local authorities that we work with in CASIR, they're 4 relatively rural local authorities, and so that was facing the same issues around all of this.
Okay, thank you. Sharon, you talked about trying to do things differently to address some of the costs, and I know we're aware of some of that already. Could you just give us a quick overview on how quickly you're moving here? Are you working at pace? Are you getting the corporate support you need to work at pace? Can you elaborate on that, please?
Yeah, definitely. Lynette has been chairing a series of meetings with the aim of moving at pace from a corporate perspective since about last September, because we acknowledged by that point that this was an emerging pressure for us. I mentioned the allocation of some additional housings in the earlier conversation, so that will help us enormously in terms of taking things forward. But there's also lots of other elements that we're considering and working with in terms of training, education, culture, etc., in terms of just developing more positive outcomes for individuals. So there's lots of focus on this in terms of our objectives over the next 12 months. So yes, it is working at pace.
Okay, I think just from discussions we've had previously, you know, councillors on this committee were quite keen to hear about how we could keep some of these young people in Powys. They've got a lot to bring. You know, we've got an aging population, and these are young people with keen work ethics. So I'm pleased to hear that, and perhaps that could be brought back to scrutiny halfway through next year to hear how you're getting on with that.
Yeah, no problem at all, Chair.
Gareth, please could you make that note as something that we've just identified as something we want in the future. Councillor Sandra, sorry, you had your hand up. Did you want to just add something on before we move on from unaccompanied asylum seeking children?
Thank you, Chair. It was just to support what has been said, actually. When these youngsters first arrived on the shores of Kent, they were receiving all the children, and it was they who made a plea to say that, you know, they shouldn't be the ones to be catering for everybody who comes in mass, and to divide them out fairly, and that's what has been done. So it's not so much the luck of the draw. These youngsters have gone through traumatic experiences, and, you know, you cannot see anything that if they have trauma that can't be easily identified. It does take time to get to terms with what is really the problems with these youngsters, which can have other add-on complications. So it's the short window of 5 days to assess these youngsters' needs, etc., and place them. That's what puts every authority into this similar situation. And it's just to say that I appreciate the question in looking at how this can be shared out differently, but it's taking the fair share really, and taking whatever youngsters we've got and doing the best we can to support them. And I'm sure that everybody has empathy with that. So I just wanted to put that into perspective. Thank you, Chair.
I think this 5-day window is a real issue though, isn't it? And what's probably frustrating is that there's probably some children that are really suited to coming to Powys that don't get matched with us. You know, they may have I know that we've got children here that have got agricultural interests, and yet they may end up being placed in an urban local authority. And because there's only 5 days. Anyway, I think the whole topic needs to be on our rolling agenda, because it's obviously very topical. Chris, did you have a question on this, or are we ready to move on?
No, I just wanted to move on, if I may. I mean, it's related,
yes, please go for it.
but on the, I note on the savings there is around grow your own, and there's 74,000 I think put in for the year ahead. Based on that, is that just on the reduction of agency staff, and how many is that in whole-time equivalents?
I think, Chris, we're going to come on to the cost efficiencies in
Okay.
a minute.
Okay,
So
that's fine.
hold fire on your question. Has anyone got any other questions on pressures? Were you able to find how many children are turning 18 this year relating to that 486?
Yes. The number of children turning 18 is 20, of which you'll see 6 then appearing as a pressure in the adults
Okay.
FRM, and the others will then move into leaving care, which is the line below.
So that 486 relates to how many children? That is it 20?
The 601. Where am I going now? The 601 is the current cohort of children that we had at the time the FRM was put together, with 20 of them moving out of CLA, 6 going to adults in their FRM, and 14 of them go into the line below into leaving care, modelled at the average cost. But at that point, there was still the 955 outstanding on the FRM of savings to be delivered in this year. And I couldn't best guess which of those children it was going to be. So you've got the line 995 as the negative.
So the 955 might reduce.
It might be off
be
either of the
attributable
lines.
to,
I
because
don't
just
know.
on a very crude level, if it's 14 children who we're saying aren't turning they're turning 18 this year, but the part year effect of having them and that extra cost that may not have been envisaged, if you divide that, that's a huge number per child for a part year effect.
But the full year effect, the 600k is the current people that we've got in the system, which is a pressure of 1.5 million, less the 900k of people moving on during the year. But they will move on their birthdays. So some will be 150 days, some will be 7 days, some will be 34. It depends on when their birthday is. It's modelled. And it's modelled at that current time. But I don't know what the pressures are, how those changing needs are going to pan out. And the then the pressure into leaving care is based on the average of what we think they will present at that time. So it's all round modelling really. And as I say, I don't know which of those children will be attributed to the 955, which at that point was going to be a savings target in this year's FRM.
Okay, I think as we have the quarterly financial going forward, it would be good to see whether these figures are moving in any way, because it's difficult for us to be able to unpick this. David, did you want to add something?
Just a general observation, if I may, Chair, because there was a lot of discussion on when we were discussing pressures around risk. And I just wanted to make the point that in itself is not unusual, because the budget as a whole, it contains about £25 million worth of pressures, and outside those, there's a certain level of risk with pressures that have been identified but aren't covered within that 25 million. And that's not unusual within a challenging budget. And I think that's an important point to note. And I think when we look at things like unaccompanied asylum-seeking children, what we don't want to do is make an assumption going forward, because an assumption is a guess. That would be a terrible mistake to make with any financial budget. So what we've got to try and do is make a prediction, and a prediction needs to be based on empirical evidence. And obviously, as it stands, that's very, very limited. So we end up with something sitting between an assumption and a prediction, and that's where the risk element comes into it. But just to assure the committee that we've got the risk budget to fall back on, and of course, if all the risks materialise and it exceeds the level of the risk budget, then that's why we've got to protect our general fund reserve. So just to make the point that the risk within a budget isn't unusual, particularly within a challenging budget, which as we're facing this year. Thank you, Chair.
Okay, thank you. Councillor Gareth, did you have a question on risk reserves as well?
Well, I have got a question on risk reserves. I was going to say that to the end with adults, I think. I've got a couple of points. Just on the contract provider uplift, I've just compared the figures between children and adults, and the figure in children seems to be increasing by 50% by the 28-29 year, but the figure in adults is much lower. And I'm just wondering why isn't the same sort of percentage? Is there a greater demand in adults for the real living wage than there is in children for the 24-25 year, and that children is mainly the contractual payments impact?
Yeah, I think they are different in that within adults, we have a better knowledge of the split in the workforce, and during the fair cost of care, for example, we understand the makeup of the cost per bed, so we then know how much is required. Within children's, most of them are high cost placements, very scarce. The cost is predicted rather than negotiated.
Right. Okay.
And the real living wage mandate from Welsh Government was about in-county, in Wales placements, and not out of county. And a lot of the children's expensive placements, for example, are in England.
Okay.
So the real living wage doesn't become applicable. The market forces becomes more applicable.
Right. Sorry, I'm jumping back now. Short breaks, there's a pressure of 84,000, but then there's a saving of 200,000. Perhaps that's one for Sharon. I'm just wondering why we got both in.
Sorry, couldn't get moved then. Yeah, Councillor Gareth, that's a little bit about what I was talking about. We've got a project that's up and running, looking at how we can deliver short breaks in a different way, and that's in comparison with looking at and reviewing and reflecting upon direct pavements as well. So Jackie will have calculated that based on information and the trajectories from last year in terms of the pressure, but we are confident that actually as an overall we can kind of deliver the model in a different way and actually have some of that saving, which actually we've seen in our Q3 figures. So I think that trajectory is realistic in terms of the savings, but also the pressure is based on the pressures from what we know of in terms of numbers, etc., in the last 12 months.
Yeah, and then my final question on pressures is the 517,000 saving from mothballing a property. There's nothing in the next 4 years to say that property is coming back into use. Where is that £500,000? I assume we're saving the £500,000, but there's a cost elsewhere, and I'm just wondering where that cost's shown in the rest of the paper.
Jackie, do you want to answer that?
Yes, sorry, I hadn't unmuted. At the present moment, that would be sitting in the placement budget, because
Okay.
to reopen the home, we'd need to move a child back in who
Yeah.
would be moving in with a budget.
Right. So that, and I know Sharon said it was because there was a very expensive child place in that home before. So I assume something like, yeah, okay, that's fine. Thank you.
Just before we move on to cost efficiencies, the in-house residential increase in staffing due to complexity of children estimated, will that have a associated cost reduction within the closer to home element of the cost reductions, which I know we're coming on to?
No, that is in regards to running our own in-house residential homes.
Okay, so it's not because we're bringing a complex child back into county.
Well, at the present moment, they're already in there, but
okay,
the staffing structure that we had isn't sufficient to meet the complexity of the need of the children.
So what
And
we're
is that-
finding is, because there's a lack of placements at UK, those children that have got real complex needs, we're finding it difficult to find a suitable placement. So then we're having to use our residential provision in a different way. But it wasn't originally set up with the right amount of staff in order to meet that complexity of need. So therein lies a kind of a pressure when you then have to have additional staff in order to meet the need and complex need of that child. So again, we're re-looking at that in terms of our overall vision for our residential care. What is our kind of who are our cohort of young people going to be that are going to live in those residential homes, and kind of plan a little bit more forwardly, rather than having to react when we can't find a suitable placement for a child. Then we're caring for that child, and then we're having to wrap around much more additional support in order to meet that child's needs. So it's a big piece of work in terms of just looking at all our homes and considering and reflecting upon which child is best suited to those homes. And then we're going to need to align budget accordingly, depending on the vision for the future.
And how many staff do you think that relates to then, that we're increasing?
It's difficult to say at the moment, and I probably could come back to scrutiny at some point when we've done some kind of analysis on the future of residential homes, if that's of any benefit. It's difficult to
just
kind of
because
say
it's a rounded off figure, you see.
Yeah,
so
but what we've based it on is what the need of what we needed during one particular moment in time when we were managing a child with complex needs at that time.
Yeah, okay. I'd like to know, please, Gareth, if you could make a note how many staff that that relates to. And then just my final question in the early help investment. Yeah, sorry, I've used the word investment because in my head I see that as an investment to save. Is that right? Is that right? The early help increased demand pressure.
Yeah, it is an investor save in terms of the additional capacity that's required due to the increase in demand within the early help process. Obviously, that wasn't part of our structure in terms of early help, but as that's grown in terms of post-pandemic, it's become a pressure here, but it's actually something that we need to consider and reflect on and enable that not to be a pressure, and that becomes business as usual in terms of that demand. But at the minute, we're growing through that, so hence why it's a pressure at the moment.
And do you feel that that growth is resulting in a trend of less children coming in, less children needing that next stage of support, and therefore is there not an associated cost reduction?
Yeah, potentially, and that's what we've got to kind of work through now. So we currently have less children on the Child Protection Register. Our children looked at the numbers have reduced if you kind of consider the unaccompanied asylum seeking children as part of the overall numbers of children looked after. So we are very much looking at our Closer to Home project as enabling children to return safely back to parents or connected people wherever possible. We're looking at that prevention of bringing children into our care wherever is possible, and that kind of reflects then when your child protection numbers are actually decreasing, that shows that our intervention and prevention is working in that way. So then your cohort becomes less in effect in the sense of children likely to become looked after. What you can't predict is any given situation at any moment in time when the needs are so significant that the local authority has to take action in terms of caring for those children. So we can't predict that. But in terms of looking at the vision as a whole, in terms of intervention, prevention, you can see that actually our trajectory is moving in the right direction. So that then should, in effect, able to sort of redistribute resource to different parts of the service where we want to build that on, and early help is part of that, front door is another part of that.
Thank you. I can't see any more hands up, so on that note, if you would like to move on to the cost reductions that you've got slides for, I just would like to make the overarching observation that historically, I don't think last year, but before last year, these cost reductions used to come with a colour coding on how achievable they were and what level of risk was associated to the achievability of them. So I would like you, please, to just give your general views on which ones are less achievable than others, if that's okay, please.
Yeah, that's fine. So utilities at the top, so that kind of speaks for itself really, and then we move into placement. So the work that I talked about in terms of stepping down from residential care into foster families or to move home, we've looked at this figure based on what we've achieved over the last year. And we're also looking at a new fostering framework. So we're looking at that as an opportunity around investment to save. And that fostering framework is looking at fostering through a different lens and having different layers of foster carers to be able to deliver different outcomes for children. So we're very much looking at developing a framework for foster carers who might be able to meet the needs of children who are more complex. And we're also looking at foster carers that may be able to support parents with babies. And we're looking at foster carers through a kind of therapeutic lens as well as looking at foster carers who might be able to support a network moving children back home. So it is a new framework. It is something that we've talked about in the past, but not delivered it. So I'm very keen to actually bring this into fruition and to deliver this model and to really enable us to kind of take things forward. So that whilst that it hopefully will go through the process of being agreed, that is definitely something that we're looking at in terms of a new vision in terms of the next 12 months. That should then help us with placements. So we have reduced the figure in terms of savings, cost reductions from the previous year. And that is based on, like I said, the number crunching and what we've achieved to date. It is one of those areas that comes with challenge through all the placement matters that we've discussed around complexity, the demand at any one point, something could occur and you're suddenly needing to increase that level of placements for whatever the need is. But it is something we're also very visionary around in terms of our closer to home. So our fostering framework needs to happen in terms of that. So it's a realistic figure, but it does come with challenge in terms of delivery, but it also comes with risk because we sometimes won't know when we need to support a child at any given time. And that is something we will benchmark over the next 12 months through our performance, just to test that out. How realistic is it? Are we still meeting that target? Can we deliver it, etc.? With our 16 plus accommodation, this is a lower figure than we put on the FRM last year. And this is based on the fact that we 3/4 have achieved that figure from last year. And actually this year we've been allocated through capital funding some additional properties that we're actually doing up, for want of a better word, right now. And we're developing that 16 plus provision with Llamau, who is an organisation that work providing supported supporting support to those young people that live in accommodation. And we've also developed a few other properties across some of the major towns in terms of that 16+ provision. So we know that where there are high costs for 16+ provision outside of Powys currently, so predominantly we've had to rely on Herefordshire and Shropshire in terms of those accommodations. Some of the prices of those supported living type accommodation can be anything from £5,000 up to £10,000 a week. And quite often when young people have to go and live in those areas, they then quite rightly make roots in those areas, go to college or training, find employment, and build up networks. They don't often then want to come back to Powys if we then have provision become available in Powys. So what we're trying to do is develop our own 16+ accommodation, because there is a growing need for that, and to really develop it across the major towns so that we can keep our young people here. So that's a realistic figure, but again, that comes with complications based on need, demand, capacity. So we still need to review that and ensure that we're on the right trajectory over the next 12 months. In terms of the Special Guardianship Order project, that is a project that has now come into fruition. We have staff in place to be able to deliver that. So I really want to push forwards with this over this next year. What that means in effect is it's a legal order that any connected person to a child can obtain for that child to be living in their household. That's why it's called a special guardianship. And what that means is that child isn't a child looked after, so they're then not subject to independent reviewing officer and a care plan and a social worker. They actually can have the same plan but delivered in a different way with a team that are going to work with all our special guardianships. This is something that lots of local authorities are doing. It's something I feel quite strongly about we need to do here, because what it does is enable a permanency plan for a child to live within their network, within their family, without having to be subject to care leaver experience or child looks after experience. So it's the right thing to do. And I think we've looked at numbers of potentially of a trajectory of how many children that might be. There is lots of further work to do, but again, we will benchmark that over the year and to make sure that the trajectory is on target. In terms of the short breaks provision, we've touched on that already. So we're looking at our policy around short breaks. We're looking at, can we deliver it more effectively, more efficiently, more cost effectively? And certainly the work that's already happening under a project that's been created, there is indication that we can achieve that. And certainly some of the sums that have added up in Q3 have said that actually that is quite doable for next year. But again, we still need to review that and make sure we're on target and in line with that. In terms of our Grow Our Own, this is based on our Grow Our Own social workers qualifying over the next 12 months and then moving into qualified social work positions generally, which happens in the autumn of any year. So that figure then is calculated on that sort of in-year effect in terms of those newly qualified social workers moving into positions before they can become registered social workers. That kind of process takes time, and usually if you're through the Open University route, you actually don't get registered with Social Care Wales to usually December. So therein lies why that figure is slightly lower than we kind of would be if, for example, everybody was qualified in April. Nevertheless, the trajectory of our Grow Our Own social workers is really positive. It's really strengths-based. We had quite a few 8 social workers that came into children's services in the last 12 months. We're looking at the same amount coming into children's services this year. So we're very much kind of looking at supporting and developing those newly qualified social workers and then slowly reducing our agency social workers. You can't necessarily move agency workers out when the newly qualified social workers become employed into their permanent positions, because it depends on the level of experience, it depends on the demand within the service, and it depends which teams they go into. So it is a process which we're navigating. Our trend on agency workers is reducing, so I'm anticipating that will further reduce over this next 12 months. Staff and expenses obviously speaks for itself. In terms of Voucher SV, in terms of reduction in hours, that is something that's already happening and occurring corporately in a different area. We've already got that kind of aligned, so there's no particular problem with that. In terms of Edge of Care, we're just looking at some of the funding that they get through different funding streams and then using that grant money in a slightly different way in terms of just reviewing that kind of baseline budget around that. So that's achievable. In terms of reduction of agency workers, not through Go Our Own, that kind of fits with what I've said really in terms of us recruiting and retaining staff. So we've got a number of agency workers who are becoming permanent, and that will continue over the next 12 months. So we're kind of based on some of the areas that we know where staff are going to become permanent at that particular time. And also we have had a pocket of money sitting within my budget area in terms of using that spend for agency workers at different juncture points. So as we're reducing our agency spend, we've also reduced this pot of money that we've had in terms of just protecting us to have agency workers when we need it. So we do think that's realistic based on the numbers and our projections around recruitment and retainment. In terms of reduction of third sector grant spend, again, we've looked at that in terms of that 17,500, and we believe we can achieve that by just offsetting things and looking at things in a different way. The same in terms of grant funding and freeing up the base budget. Again, we've looked at that. In the last couple of years, I understand that we've had that on the FRM. Certainly in my time, we had it on our FRM last year. It is an area of challenge in one way because you don't know necessarily if you're going to get all the grants that you need, but nevertheless we will look at that over the trajectory of the year and ensure that we're on target with that. And if there is a pressure or a challenge with that, that is something that will be raised at that particular time. In terms of staffing and transformation and redesign, these 3 posts haven't been filled in the last 12 months. They were put on hold because there was no staff actually sitting in those posts at the start of April of last year. So we're taking this forward into this year in terms of those posts actually will be removed from the system, and that kind of frees up that kind of money in that way. It won't create any deficit to any part of children's services in terms of that reduction. Connor, do you want to take me on? Okay, so in terms of finally, there is a decrease in the budget of 50k, as you can see, and the final budget for 24-25 is 29.432, and currently the budget is balancing in terms of that. There are some areas, like I said, around the savings for this year, which still needs some work on because that figure has reduced, and Jackie and I will work together on that over Q4 in terms of the final analysis from this year's FRM in preparation for next year. So thank you for listening to me. If there's anything that doesn't make any sense in terms of what I said, welcome any questions around that, and over to you, Chair.
Thank you. Thanks, Sharon. That's, I really like this style of how you presented the budget and for adults as well. So, yeah, it gets at all the issues in a very straightforward way in terms of pressures and going through it line by line. So thank you for that. Councillors, over to you. Who's got some questions on cost efficiencies? Councillor Chris. Could we have the slide of the cost efficiencies back up as well, if that's okay? Sorry.
Yeah.
I just wanted to obviously thanks for the going through those. I think that was really helpful. In relation to Grow Our Own, just some points of clarity. In relation to when they're doing the programme, how many have we actually got on the Grow Our Own programme currently that will then be coming into the workforce this year? And is that then, and I think you've partly answered to say that it's not going to necessarily reduce the amount of agency initially, but over the longer term it will. But do the social workers who want to work then with children have a specialist option within that programme, or are they generic in the sense that they could work with both children and adults on there? Because I think that would be helpful to just know. And then, are you then saying that there's going to be, just see, a reduction then within the agency spend, because looking at one of the tables that on the, it was noted that there was around there's increased demand coming through in the system, and you've partly flagged that up. I always then think that we reduce staff down, and then all of a sudden it comes back to bite us again. And I just want to make sure that you've considered that risk aspect to it, just to give us the assurances on that, please.
Yeah, thank you, Councillor Chris. I don't have the numbers in front of me of the totality of the number of students that we've got through the Grow and Program, but I can certainly get that for you. In terms of the projections, so there's a cohort of students that are going through at different levels. So the training can take 3 to 4 years. It is a generic program, so it's something that we're invested across children's and adult services in terms of that program, but invariably students will choose their pathway in terms of whether they want adult services placements or they want children's services placements. Quite often you have a mixture of those placements, so that when you come up to your kind of final year, you tend to do maybe, so say for example, for myself, I did 2 children's services placements as part of my training because I knew I wanted to work in children's services. If you wanted to work in adult services from the offset, you probably would do something similar and choose 2 placements in adult services. If you weren't quite sure, or you wanted an opportunity to look at things differently through a different lens, you would probably choose 1 adult service placement and 1 children's service placement. But in your final year, you'd specialise probably in the area that you wanted to go into, because that gives you the next steps really into employment. So there's lots of opportunity. You can do a mixture or whichever route you kind of choose to take. In terms of the agency numbers, we've looked at our current kind of structure. We've looked at where our current gaps are in terms of social workers. We've looked at what our projections are around, like you said, around capacity and demand. And yes, you raise a really, really interesting question around that. We can't always necessarily predict things in the way in which we'd like. So we look at kind of an overarching perspective of where those peaks are, where those troughs are, which teams are likely to kind of maybe have more challenges around recruitment and retention. What can we do differently around that? So it's almost kind of, we've got a whole workforce plan that's kind of looking at that as a whole. So it is kind of based on that kind of evidence of all the work that's happened in the workforce plan. It's looked at our capacity and demand coming through into children's services. It's also looked at our vision in terms of where we want to kind of mobilize all our kind of staffing in terms of those key areas, but it's also looked at the amount of agency workers that we've got and our trajectory over the last 12 months, which has been a downward trajectory of agency staff. We were at one time up to 57 agency staff, and we're currently down to 22 agency staff in the service. And that trajectory will further reduce as we build and grow our own, with the view that within 2 years, hopefully we're down to as close to 0 as is possible in terms of agency staff. Agency staff, however, do bring a lot to Powys. They bring a wealth of knowledge, experience in terms of them. So they're invaluable to us in terms of delivery of a safe, effective, efficient service. But nevertheless, it does come with additional cost. So therefore, we're always navigating when we're kind of replacing agency workers, who we're replacing them with, and how can we safely kind of manage the service in the best way possible with exiting agency social workers and growing our own. What we're finding with agency workers now, because they're getting less, there's been lots of interest to actually move to permanent positions. And so that's really important for us. So they've kind of already invested here and then they want to further invest here. So I'm sorry and apologize, I can't give you the numbers in terms of total of grow our own. And I don't know if there's anybody in the call who might know those numbers, but I'll certainly get them to you. And if it's helpful, I'm more than happy to come back to Scrutiny at another date with any information around grow our own programme and those trajectories that I've talked about.
Yeah, yes, please. I think it would be helpful for us to have those figures going forward. And any other questions, Chris? Are you happy with that?
I just happy with that. I mean, it seems that that's quite robust, and I can see that if we've gone from 57 down to 22, that's a positive step forward. The other thing that you'd presented, I think, in the first set of slides was that there was a grant, and that was quite a significant grant coming through. I think it was around about 621,000, if I recall. I always get concerned when posts are funded via grants. Can you just clarify how long that grant is for, and is that going to be reoccurring? Because you indicated that there had been a reduction from what we previously had, and how does that factor into your base costs and all coming round to give you the balanced position? Because you're then saying that we're going to be saving 50,000 on the overarching budget. Does that make sense?
Yeah, no, absolutely. Thank you, Councillor Chris. And Jackie might want to come into this because she's lived and breathed this grant for kind of far longer than I have. To be honest with you, we weren't absolutely sure we were going to get the grant for this next 12 months. So when we did discover that actually we were receiving it, that was great news to both Sharon Fruin, Rachel Evans and myself. I'm sure Nina and Lynette was equally joyed, as is Jackie, in terms of balancing the books in terms of everything. The social services grant was originally set up to enable local authorities to kind of support workforce in a different way. And I think it kind of started either pre or post pandemic, but Jackie will be able to tell you more about that if you need that. In terms of the longevity of it, that's a really good question. We've had a reduction this year and we've got the grant for the next 12 months, but it is one of those areas that Welsh Government could consider to not be required any further. I think it would come with many challenges for many local authorities because the grant is very specific around sustainability and in terms of workforce, and it does enable local authorities to try out new things more creatively too. So lots of the posts that we've got going forward for next year are creative posts where they're looking at specific projects or maybe undertaking a piece of work that is helpful and essential really for children's services to go forward. Wherever is possible, and I know Sharon Fruin has considered this too because we've met this week to look at the grant, is making sure that wherever we can actually move posts from that fixed term position into our base budget as permanent positions. So in children's services, we have done some of that work this year. So we have moved some of those posts into permanent positions rather than have to continue with the anxiety for the workforce around the reoccurrence of the grant and is it actually going to be here or not. So wherever is possible, we try to move those posts into the base budget to lessen that anxiety for staff. I hope that's answered the question, but Jackie may well want to come in with just some more narrative about the grant.
Jackie?
Yeah, the grant has been since COVID, and it is to sustain the workforce. And because we weren't sure of how long it would be given for, they are all fixed term posts. And at the beginning of the FRM process, we weren't aware whether we were going to receive it or not. So that's why it's put on as a risk. But we haven't put it down as a pressure because they are fixed term, and we would be looking at trying to remodel our current staffing or manage those posts in another way, in line with what the council's aims are really around grant funding.
Thank you.
I mean,
Chris, any follow-up?
well, it does pose some risks, and one that needs to just be monitored going forward, because obviously if that was stopped or reduced further, it's the implications to that. So the transformation and redesign of service becomes much more critical as a part of that going forward. Again, I see that you've made a reduction target within that, and we just need to keep a watching brief on that. I've dealt with grant funded posts myself where they become considerably risky, so hence my question. But I'll stop there, Chair.
That's
Thank
fine. No, I think that it would be good for us to flag that this is something that the committee is, highlighting as a risk going forward. Councillor Gareth.
Yeah, thank you, Chair. Just one quick question, really. You've got the placements and 16+ accommodation, reduction in agency staff, just in for reductions for 24-25. Are there expected reductions in the future years as well? And if there are, why haven't they been built into the model?
Can't answer the question about why they haven't been built into the model in terms of future trajectories, but maybe Jackie or Jane might be able to answer that. But in terms of the vision, there is that continued vision of closer to home, early intervention, enabling families to receive the right support at the right time is critical, and that will continue in terms of the vision of children's services. So in effect, that should have an impact on some of these costs that we kind of see as pressures and some of these areas of cost reductions. But to give you exact figures in terms of now, I can't give you that in terms of future years, but in terms of the overarching vision, that's absolutely the trajectory of what we're going on. And to provide assurance, that's what we will continue to strive to do in terms of keeping children safer at home, not creating those kind of opportunities where children need to be looked after. Is much more focused on enabling that family to live together, and where the support will wrap around that family at home, rather than actually think that child needs to be accommodated, where the local authority need to care for that child. So our vision, as I said at the very beginning, is very much about strengthening all around early help, right time, keeping children closer to home, and then building that sustainable workforce to enable us to deliver all those aspects.
Okay, and just one follow-up question to that, Sharon. Of these cost reductions, which is the one that's at the greatest risk in your mind of not being achieved?
I think placements is always that area where there's greatest challenge and greatest risk, because you can't always predict what's going to come through in terms of an individual child's needs. And for example, one child can cost upwards of one of the most expensive placements we've had has been up over £20,000 a week.
Yep.
So if we were to have to support a child and a family in that way, of course we would do, but there would be a cost implication to that. So that for me is the greatest challenge, but also the greatest risk in terms of delivery.
Yeah, thank you.
Thanks, Gareth. Jane, did you want to come in on something that's been said before?
I did. There was a couple of things. I'll pick up on that one as well, if I may, but it was just around the grants. I think we're really pushing with Welsh Government to reduce the number of specific grants due to their temporary nature, not having that understanding of whether they're going to continue. So as part of the commitment from Welsh Government in terms of reducing the administrative burden of grants, we are hoping to start to see more grants being amalgamated, or even more flowing through into the settlement unhypothecated. So we're just keeping an eye on that, and I think we may well see some changes with that regard coming through in the final settlement as well. So just to make everybody aware of that. The other thing I was just going to pick up on was the fact about future projections. Absolutely, we should start to see those factored into our 5-year plan, even if they're estimates. into those future years, it's important to recognise where we think we're going to be able to make these efficiencies as we go through. So I know we're working with heads of service to make sure we have that much clearer longer term plan. So I'm sure you'll start to see those featuring before long.
Thank you, Jane. I've just got a couple of questions and one overarching question. Could you explain, please, and perhaps this is a question for you, Jane, how the decision was made in terms of which of these came with impact assessments and which didn't, given that we've only had the one impact assessment for the short breaks reconfiguration?
Yep, I can answer that. I think you'll all recall, in terms of last year's impact assessments, there were thousands of pages. So what we have tried to do is to rationalise that without losing sight of the impact, obviously, of any proposals. So where we were able, we considered the impact in the general impact assessment, but where there was felt there was more significant impacts, particularly to our service users, then those were required to have an impact assessment for individual elements. So that was the basis we looked at, and very much then led by heads of service as to which they felt were the ones that needed to be supported by those individual impact assessments.
Okay, I guess the point could be made that some of these have been ongoing cost efficiencies where similar things have applied the previous years. So, you know, would it be an option to just have a rejig of the, you know, the special guardianship order one, for example? Could that not have just been put in and just reassess, you know, just for the public's point of view, just to, so that they know that you have looked at that specific impact previously and are just including it because you're aware that that continues, that impact continues?
I think if I come back in, I mean, I think if the committee feel that some of those impacts aren't clear, then absolutely we can look to strengthen that. If they have been there in the past and committee would like to see those again, then obviously we can do that.
Okay, I'll give that some thought. Thanks, Jane. Just on that though, on the impact, on the VAW, that's the violence against women domestic, that's the post to do with, I can't remember the acronym, sorry. Could you just tell me the acronym fully? Sharon, sorry.
It's violence against women and domestic abuse, yeah. So it's kind of that, Jackie might be able to explain this slightly better than myself, but it's we deliver it in a different way within children's service. And I think originally it was set up that there was a whole post created sitting outside of children's services, etc., where the expectancy was around delivery of training, etc. We've just reassessed that in terms of what we're delivering and how we're delivering for that, because we offer a multitude of different training opportunities around this subject matter and involved in it on a multitude of layers, both locally and regionally.
Are we, because I know there's a lot of stuff done in terms of awareness for the public as well in this area, are we reducing what we're offering for this, or is it just being reconfigured?
Just realigned in a different budget area, unless Jackie, you want to come in and add anything?
No, that's correct.
Okay, because you know, the
There'll
impact
be no reduction in service.
Because the impact of educating in this area, you know, is incredibly important, and this is the kind of thing I'm getting at. Although it could be a very short impact assessment, someone looking at this from outside could suddenly go, oh no, they're going to offer, you know, there's going to be less training in this area. So I appreciate that there's no impact, but from a paper point of view, that's not clear because there's no impact assessment. I will come back to you, Gareth. Sorry, I've just got a couple more questions. On the short breaks one, which there is an impact assessment for, in it says that there's going to be a creative approach taken to looking at short breaks. Are you able to give us sort of a case example of how things are hoping to be different here?
Yeah, definitely. So one example is a child with complex needs living within their family setting, and where the parents need a short break from the complexity of managing that situation, we've actually looked at it sort of slightly different, more creative way, whereby the child remains in the home and the support goes into the home to deliver it, and the parents go away for a break doing something else, whatever they choose to do, rather than the child coming out of the home and going into maybe residential short break provision, which is far more costly, and the parents still do what they want to do. So we're kind of looking at things from different perspectives. So that way the child remained in the home. The cost actually was reduced quite significantly because the support staff went in to care for the child rather than the child having to come out of their home. So it's things like that, assessing individual needs, assessing if we can do and deliver things in a different way, more creative way, more outcome focused for the child per se.
That sounds like a brilliant idea, because children like stability and routines, and parents like to get away for a break. Is there a reason why examples of such creative ideas couldn't have gone in the impact assessment?
I suppose it could identify that particular child and etc. I don't know. We didn't kind of go into that level of detail in the impact assessment. I guess maybe it could have, in terms of just an overarching theme of what we were trying to do. So I take that point completely. Yeah, there was no reason
maybe it would, anyone who
I
is,
guess it makes more sense, doesn't it, if you've got a kind of opportunity to share what creative ideas mean and how that translates into kind of realism. So I take that point, Chair, completely.
Can we make a note of that, please, Gareth? And the reason why I make that point is because if you are someone who's in that situation and you go and read this impact assessment, you might be quite alarmed, but yet you would be reassured if you'd heard what you've just said. And my final question is on the staffing one, the staffing transformation and reduction. I completely get what you're saying, and this probably is going back to historically when these posts were advertised. But why were they advertised in the first place? What's changed, and why do you now see them as surplus to requirements?
Okay, so they were based on need originally. So they were going back historically, probably about 3 to 5 years ago, post the kind of poor inspection in terms of children's services and the journey and trajectory of that. And some of those posts were filled at the time, and then people have moved on to other things. So it was really taking stock of all positions that we have in the service, all positions that have been vacant for a considerable time, and then assessing, did we actually need those posts? Do they offer any value to us into the future? And we reviewed that and felt that these 3 particular posts, which hadn't been recruited into for some time, and where needs have changed for the service, that we were able to kind of just remove them from the structure.
Okay, thank you. Gareth?
Yeah, just a very quick point, Chair, that's going back on the points Jane made about the impact assessment. And this doesn't apply to adults or children's services impact assessments. I just feel the general quality of the impact assessments that have been done is less than poor. There's a couple of them that, I don't feel they're worth the paper they're written on. I just question that. And for me, I want to know what the proposal is, what the impact on the service user is, and what the risk around each of the growth bids and also each of the pressures. And, I've gone through the budget papers. I don't feel I'm getting that at the moment.
I agree, Gareth. And I think, I do think the ones for adults are better than some of the ones in other services. But the point I would say is that I would always want to put myself in the shoes of a service user who gets that service which is being reduced, which is why I've just made the point about the short breaks one. If you've got a specific interest in this service and you are a budget geek and you go and read these, what would you be alarmed by in an impact report, and what would you be reassured by? And that's where I just think the starting point should be.
And I would actually go further, Chair, because what Sharon's just described about that example isn't a reduction. That's in my view, an improvement in actual service to the family.
Well, it's transformative. It's
transformation.
Isn't it?
Yeah.
So, but we always have this debate about what you call this area of the budget. Is it is it a cut? Well, some of them may be, but the majority of them are transformative, aren't they, or reconfigurations? So, but right, it doesn't look like there's any further questions from members. I have written down on my paper that I wanted to start adults at 11:25, so we are in good time. I thank you, Sharon, Jackie, and Jane. Jackie, I know that you've got more contributions to come, and thank you, Lynette. And sadly, Lynette, this will be your last budget with us.
Yes, thank you, Chair. It is my last budget with you. As you know, I will be retiring at the end of March. And thank you, just for a minute, if you don't mind me just saying that, you know, it's been a real privilege to be the Director of Children's Services since July 2022, I think. And I just wanted to put it on record here, really, the work that Sharon and the team have done in the last 2 years, ensuring that, you know, the budget you've got in front of you today is a budget that is balanced going forward, and also without a huge ask in terms of extra funding. And I just wanted to say,
absolutely.
the service is challenging. It's a really challenging service area. I know that you as scrutiny members know that, but the complexity of need is increasing, and at the same time we've got a really good workforce now who are really working hard to ensure our children are kept safe. And what I wanted to say as well, and I put a marker here as well in Scrutiny Committee, that we are expecting at the beginning of February, which is only a couple of weeks ago, a JICPA report, that is a joint inspection on child protection arrangements in Powys. And the team worked really hard for that, and obviously it does have implications on the budget and and the work that we do around child protection. And we look forward to that report being published. It's embargoed at the moment, and until the time of publication, but we look forward to the publication, and I'd be really proud when that report comes out to being Director of Children's Services for this period of time. And I think that it would be remiss of me not to put that marker down today, that we are expecting that report out very soon, and we look forward to Scrutiny looking at that report, and in the context of the budgetary restraints that we have as well. So thank you for that, Councillor Jenna. Thank you to the committee this morning for taking us through this scrutiny session, and thank you to the officers who have prepared and worked hard on this budget. I have to say, Sharon and the senior managers alongside Jackie are really thorough and robust in ensuring that their budgets are kept in check. So it's been a real privilege for me. So thank you, Councillor Jenna.
Thank you, Lynette. And yeah, I think, you know, Sharon, it was your first budget last year, and we were very, you know, we were very quick to ask you which cost efficiencies were achievable and which not, and you were very candid about all of that. And you've come back this year having, yes, there's still some more to be delivered, but they're not at risk of not being delivered on the whole. And so, you know, we're grateful for sort of for that side of things and how you've approached that. So yes, right, ready to move on to adults. I'm going to just have a quick, if we can have a quick 5-minute comfort break, get yourself a cup of tea. Connor, if we on, but if everyone could turn their mics and their video off, just ready to restart just as shortly after 11:25 as possible, please.
Thank you, Chair.
And there we go. Is everybody back? Okay, welcome back, everybody. We're now looking at going to scrutinise the adult social services budget. Welcome to committee, Rachel Evans, Sharon Fruin, Nina Davis, and Jackie again to kindly take us through the adults budget. Again, are you going to share your screen in a similar way to children's?
I will, yes, Councillor.
Yeah, brilliant. Okay, well, if we can hand over to you, that would be great if you're able to give us an overview, and then if you're able to just pause after pressures, and then if we've got any questions on that side of things, we'll ask those then, and then we'll go on to cost reductions. And Councillor Shan, please just feel to interject and add anything you want to when you do, and thanks for coming to committee.
Thank you, Chair. Bore da pawb, my name's Sharon Fruin. I'm the head of adult social care, and I'm joined today by my colleague Rachel Evans as head of commissioning and partnerships, and Jackie Pugh from accountancy, who will have all the detail and be our life-saving ring. I'm just about to share my screen, so bear with me. Oh, sorry, bear with me. Can I ask, can everybody see that?
Thank you. Yeah.
Yeah, so a general overview of adult social care. I know I don't need to go into much detail, but the priorities really haven't changed. Our focus is still around our strength-based approach to ensuring that people live the lives that are important to them, build their independence, focus on their own assets and the skills and support that they have naturally, building their circles of support within their communities and ensuring those communities are resilient, and then working with partner agencies such as the third sector, PAVO and the Health Board and others, to ensure that when people do need additional support, they get it at the right place, in the right time and at the right level for them, so that we don't create dependencies and we ensure that people can remain as independent as long as possible, with a focus of them remaining in their own homes for as long as possible, and hopefully needing less significant support as they get older. It is worth pointing out that the pressures we face in Powys, we have an ageing population, as you all know. We have a significant amount of people who are aged 65 and plus. We have a reduced working age population, which has a big impact on our workforce and our ability to provide services. And our demography and our geography means that actually we're, as everybody knows, we're very dispersed. Ensuring equity of services and coverage of the county is quite a challenge for us, but it also means that we are working across our borders, particularly around health support and facilitating discharges from hospital, as we don't have a district general hospital. So that's a really brief overview. I know, Chair, you've asked me to give a whistle-stop tour because we want to focus on questions. So in adult social care, we've got a budget, as you can see at the top, of 80.664 as our base, and our pressures are there outlined around inflation. So pay and other costs totaling 958,000, a significant issue around the real living wage, in service pressures and contract uplifts further on the page. And then our demography around that older age group, people living longer, people actually having more complex conditions. Due to the success of medical science, we're seeing a lot more children with learning disabilities in particular living with very complex coexisting conditions, and we map the number of those and try and understand their needs by working with children's services really closely, to understand what that pressure will look like when they turn 18, doing that preparatory work very early on, as soon as possible, making sure that we can actually future-proof our delivery plans, ensuring that we've got the right support and services available for when they do come into adult services. You can see that contract uplifts and the real living wage is a significant pressure. We had done some working on an estimated best guess approach to what that increase on the real living wage would be. It is now, we know, to be £1.10 an hour, which is slightly more than we were expecting. We are committed to being a real living wage employer, and understands, you know, the issues that people are facing with the cost of living and the need to actually pay people the wage to attract the right workforce. But this, it does increase and place a significant pressure on our budget. We obviously do all we can, and we work constantly to negotiate with in the realms of contract uplifts. My colleagues in commissioning are working constantly with providers. However, we have seen several providers very early on this year contacting us seeking larger uplifts than expected because of their increasing costs and their ability to maintain their services. The provider market is already fragile across all areas. We've got a shortage of supply. Demand continues to outstrip capacity, and we've seen several providers over the last few months handing back packages on a regular basis. We constantly look to see if we're making the most efficient use of the resources we have in the marketplace, but we are expecting a challenging few months ahead. To try and mitigate against those pressures, we've held several roadshows with staff trying to identify potential projects, ideas on how we can make efficiencies, ideas on how we can be more efficient in the way we deliver services, how we could deliver services in partnership with people so that we can reduce costs. And all of those have been taken into consideration when we went into the budget setting process. The pressures we hold at risk, some of this has already been covered by Sharon when she took us through the children's services budget, but we've, in particular in adult social care, we've identified 5 pressures. So the social care workforce grant, as Sharon mentioned, we've seen we weren't sure when we first entered into this process what that grant would look like, if we would have it. It has been confirmed, but that there will be a 22% reduction. And as Sharon mentioned, we've met and looked at all those posts across both adults and children's services, identified which posts we need to prioritise, which posts we could fund differently, which posts we could bring into our base budget. Obviously, as Sharon described, the uncertainty of the funding for staff in those positions is significant. We can often lose staff because of that uncertainty, because they start looking for other posts to secure their financial position. So wherever possible, we'll be looking to make those posts that have been identified as a core function, bringing those into our base budget. We have met and had those discussions and happy that we'll be able to mitigate that reduction. The next point is around the Regional Integration Fund. A similar theme, really. It's never assured that we will be in receipt of RIF monies year on year. We have agreed the funding for 24-25, so this isn't a risk for us this year, and we will be working throughout the year to review our requirements for subsequent years to make sure that those risks are mitigated. I've touched briefly on the demography and the older pressures, the pressures that we see in the increasing numbers of people living longer. We've holding those pressures at risk. We constantly work to understand what that population looks like, what the demand looks like. We're constantly working to increase our preventative offer to ensure that people are needing less support as they get older, and working in conjunction with our partners around things such as the Frailty Project, and technology-enabled care, to make sure that people can remain in their own homes for as long as possible. The provider uplift, I sort of covered in the first part slide. This will be managed via robust contract management. with aims to reduce the amount of voids and use of spot bookings and fully utilise our block beds. And then we've got an unusual one, really, our extra care facility. As we bring this new model of support online, it's a bit of balancing act, really, of being able to deliver that new model of support and manage existing demands. There's also a risk where we are increasing the amount of jobs available, placing a demand on the workforce in a specific area. That can see movement in the workforce from other areas such as dom care and supported living. And if we do have major gaps which destabilises the marketplace, we often get handbacks, or we are in a situation where we need to draw on agency staff to fill those gaps. Although temporarily, there is a cost incurred there. So that's about, sorry, I need to go back. So that's about delivering the new model of care, which is a positive and has been in train for a long time, but it does come with some unintended consequences if we're not on top of the situation. To mitigate that risk, we have increased our OT and social work capacity in that project to make sure that where possible, we are ensuring that individuals requiring extra care who have had domiciliary care package previously, we right-size those packages, and that funding comes along with them. The model is based on a three-tier model of funding of support, but it does need very robust assessment from the social work and OT teams. So that extra capacity has been put in place to mitigate that risk.
Okay, great. Is that the end of pressures then, Sharon?
It is the end of pressures, yes.
Okay. Councillor Sian, Nina, Rachel, anything you want to add before we just start asking questions on pressures? Rachel.
Yeah, and thank you, Sharon. I think Sharon's covered it in really, really good detail. I suppose the only thing I wanted to add is around the pressure in relation to the contract uplifts, which, as we can see, is significant. I think it's safe to say that most of our service providers are as lean as they possibly can be, and that's as a result of really good and robust contract management and negotiation with providers over previous years. And we've been able to make efficiencies or remodel services really effectively. I think the pressure going forward is going to be more challenging as a result of some of that previous work. That said, we are still continuing to work with organisations. We have a number of transformation projects in place, such as the transformation of domiciliary care and direct payments. And that relies really heavily on working collaboratively with all of the organisations to understand those pressures in detail and to look at some creative solutions to responding to that. And we're already starting to see some really good ideas emerging from that, which we will be taking forward into the next year to be able to test and pilot those approaches.
Thanks, Rachel. Councillor Sian.
Thank you, Councillor Mandy. And I just wanted to sort of share some numbers that helped me when I was learning about all of this, as a new councillor, helped me sort of understand the context of provider uplifts and what service providers are demanding from us. And I think it's probably worth mentioning that, I think, correct me if I'm wrong, Rachel, but for a long time, year on year, annual budget setting, the commissioning team would try to hold annual increases from service providers at around 2.53%. And now we're looking at between 11 and 26% just over the last couple of years, because of the impacts of the things that are outside of our control, like the real living wage and inflation and other factors that we're all familiar with. So real living wage uplifts total this year 6.3 million, I think it is, correct me if I'm wrong, Jackie, which you'll see is an inordinate percentage of what adult social care has increased costs are. So much of it is taken up by real living wage, and it's not something we're complaining about. As has been said, it's absolutely right that we pay the real living wage at least, you know, as a minimum. But it you know, the stark facts of it is that it's a huge financial pressure on our budgets, and that we have to manage. And there are additional pressures for providers as well. So Welsh Government has mandated that care and support workers should get real living wage, but of course that creates ongoing pressure for providers because they've got a hierarchy. They've got ranks of workers in their organisation, and there has to be a differential, doesn't there, between lower tier workers and medium tier workers and higher tier workers. So providers have to look at how to maintain that differential when they have to raise the wages of lower tier workers. And I think the guidance from Welsh Government is for on costs, national insurance, etc., is around 20%. So providers are going to be looking for to include that in what they ask us for as well. Costs of Care Inspectorate Wales registration, which is now obligatory for them. So these are all factors in what they have to do. In the way that we respond to them, we're shaping the market effectively. You know, we don't if we hold too fast to not increasing and recognising the pressure that they are under. As Sharon has said, we're looking at increased numbers of care packages being declined in the first place. We can't find care packages because providers won't pick them up, and also handing back the ones that they've got. So all of our savings and the work that we're doing, strength-based, approach-based, everything that we do is around maximising people's health, fitness and independence so that they don't need care services in the long run. But in the meantime, we have to manage those with care and support needs now.
Thank you, Sharon. Rachel, did you want to add to that before we go to questions?
Yes, just very briefly, and I think Councillor Sharon has gone into some really good detail there, which adds some really good context. The only thing I wanted to add is that we are still seeing a really challenging workforce, and all providers are seeing workforce pressures. And of course, the knock-on effect of that is a greater than usual reliance on agency provision. And of course, that then increases the costs on provider services. So that's a continued pressure that we've seen year on year, and that continues to be a pressure.
Yeah, thank you. Councillor Gareth, do you want to kick us off with questioning?
Yeah, my first point, thank you, Chair. My first point isn't a question, it's just a request. You've got the pressure of children coming in at 18 to the service, and I think this may be for Jackie rather than India. What I would mind to see now, they track through from pre-16, 15 plus, and then as they move into adults at 18, so we can just have one summary of that overall change. My question is around the placements. You mentioned that the real living wage is 6.3 million. So I've got two questions. And this first one is how much we've got within the settlement for the real living wage, just so I can see what the gap is between the 6.3 and whatever it is. And the second question, that 6.3 million then leaves 2 million. For the 4 future years, it's over 4.5 million. So can you just describe what I know Rachel's done some of it. What are the key factors in 25, 26 and future years pressures to give those figures?
Thanks, Gareth. Rachel, are you able to take those, or does Jackie want to take the first one first?
Shall I start the first one then?
Yeah.
Regarding the pressures going forward, I've just assumed that the real living wage isn't going to be as high as it was in this financial year of £1.10 increase.
So you've okay. Yeah, so
until they announce that in the autumn, I don't know. I've just assumed that it's going to be a lot less. Also, right, yes. I've assumed that the RPI and CPI is going to be in a downward trend.
Right. Okay. So have you assumed that for energy costs as well and things like that? Maybe a yeah. Okay. Yeah. Right. Okay. Right. Thank you for that.
For the 2 years on energy, right, as we were asked to model.
Yeah.
Thank you.
Jane, did you want to add to that?
It was just on the real living wage element. We don't have exact figures. It's not identified in the narrative or the settlement itself. It's included, we're told by Welsh Government, I think, in their letter that we received, that the joint commitment, obviously between ourselves and Welsh Government, includes that real living wage commitment. But it does not, it states that it is within the budget, but it doesn't give us a figure. So that's not identified separately. What we do know is when we look at our settlement calculation, we see the figures around the individual standard spending assessments for each factor. Of course, it's not hypothecated, but what we do see within the settlement is an overall increase in the IBA for social services of 6.2 million.
Okay.
And obviously the pressures that we're seeing across children's and adults exceed that level of additional funding. So obviously we're having to support the extra ourselves then through the budget process and through council tax increases as well.
Yeah, I've got in my head, I've heard a figure of somewhere around 2-point-something million for the, but I've got no idea where that came from.
Okay, I think last year there was an overall Wales figure of what had been included in the settlement with regard to the real living wage, and we estimated, again, it's not identified separately, but we estimated that was around 1.6 million for us, but we know our pressures were exceeding that at 2.3 million last year anyway.
Right, okay, so that gap's just got bigger.
Yeah.
Yeah, thank you.
Jane, in terms of the 2.8% increase in the RSG, then, is what you're saying you're able to identify from what you get a 6.3 million increase towards social services to account for real living wage, but once you spread that between adults and children's, the percentage increase that's required for the real living wage and contractor uplifts is just far in excess of that.
It's not, when I quote the 6.2 it was, but that isn't just for the real living wage. Okay. That just shows the general. So that could be data changes. It's accounting for general pay, demography, inflation. Everything would be factored in. It's part of that overall increase that Welsh Government have been able to provide us with in terms of the settlement.
Okay, and I've written down, sorry, me and Gareth are just plucking things out of our heads and what we've written down previously. I've got written down real living wage is increasing by 10.9%. Where can anyone jog my memory as to where I may have got that from our pre-meeting?
Yeah, the £1.10 per hour.
That's the £1.10 that's on average is going on top of what you paid them last year. So
it comes to 10.09, Councillor.
10.09.
It's a 10.09 increase on last year's. The difference between £10.90 and 12 is a 10.09 increase.
Yeah. Okay.
That makes sense.
Yeah. And, you know, looking at this very crudely, that's a 10.9% increase versus a 2.8% increase in funding. Yep. Okay, is that a fair, but a crude, I realise it's crude, but is that a fair percentage comparison to make?
Probably not.
Sian's not.
Because obviously the proportion of the budget is so much different between those elements. I think probably the best way to look at it is if you look at where we are from general inflation, where you look from pay awards, where you look from all of those cost increases across all of our services that we've seen over the last year or two, a 2.8% increase in our overall funding is nowhere near enough to meet all of those additional costs. And hence that is why we are seeing a significant level of cost reductions across all of the council services, as well as an increase in council tax being proposed to actually fill that gap.
Yeah.
Thank you. Sian, did you want to add?
Cost.
Sorry, Sian.
Sorry, I'm being cheeky and just continuing to have the same hand held up to come back on this, but it was just really to point out that, so the on cost, the 20% that Welsh Government recommends to add for on cost, like pension, national insurance tax, etc., are 20% of whatever the new figure is. So it's now, 20% of the additional £1.10.
Okay.
And then you've got CIW registration as well, and the other complications around hierarchy within organisations. So
Yeah.
the 1009 is an increase enough, but then there is more on top of that as well.
Yeah. Okay. Thanks, Sian. David, did you want to add to this?
Yeah, I was just on the real living wage. The 10% increase was based on the 23-24 inflation rate. So obviously that's come down. When we're looking at 24-25, the projection is going to be about, I think some are talking as low as 3%, some are talking about even lower than that. But if you take our settlement for 23-24, I think it's about 7 or 8%, Jane, wasn't it? Well, if you add the 2.8 again to that, it's not a million miles away, actually. If you're just taking it on bare percentages. So I think the pointer needs to be perhaps, what they've set the actual hourly rate for the living wage against, which is the prevailing inflation rate at the time. Compare that to the in-year forecast, the increase we had for our budget at the start of the year. So 23-24 would have been about 8%. And then you're coming into 24-25. And we've got 2.8%. So it's not a million miles away. It isn't there. It's nowhere near there. It's not covering it all. But it isn't as bad as saying, 10% against 2.8%. That wouldn't be accurate at all.
Jane, did you want to add to that?
Sorry, I hadn't a minute. No, I think David has set that out well. You've got to be careful with percentages because it does depend on the proportion, doesn't it?
Yeah, that's why I sort of made the point, but then asked whether it was a fair point to make. Gareth, do you want to come in? Oh, you want mute, Gareth?
Yeah, apologies, Joe. I've got a dog that's barking on occasions. I just put up on that point. We've also got to be aware that there was quite a significant increase in the living wage last year for April 23, which would, you almost, you're looking at a 2-year trend. You need to take both figures into question. But that wasn't my question. My question was, could you just let us know what the total budget for contractor provider uplifts, the budget is that we're uplifting? Because it's a £8.5 million uplift on what?
Hoping Jackie has
I'll
that figure.
I'll get that figure to you, yes.
Okay, thank you.
Just on this area as well, while Jackie's looking for that, how do we compare with how other local authorities are finding this in terms of a pressure, both sides of the border? Is it all looking very similar in terms of what they're expected to increase paying and contractor uplifts versus the money they've got in the pot?
Chair, if I could come in, conversations at AWASH are very similar across the Welsh authorities, experiencing exactly the same pressures. Sorry, I jumped in ahead of Rachel.
No, that's fine. I guess that's answered it partly. I get the other question is, are we ensuring that we're remaining competitive as well against, everyone's competing for the same market, aren't they? Rachel?
Yeah, I was just going to say that I think all local authorities are finding similar pressures, but also there's a real commitment to work together to look at shared solutions. And an example of that is we've been working together to look at a franchise model for domiciliary care, to look at whether we can be creative in terms of providing opportunities and efficiencies for organisations to share some of those costs. So I think it's safe to say that I think the pressures are similar across all local authorities. I think the added pressure that we have in Powys, which Sharon's already articulated, is the pressure around demography, the geography of Powys, and some of the unique pressures around providing services in some of the most remote areas, which is why we've got a specific piece of work around modernising domiciliary care to look very closely at how we can do things differently and put different models in place in order to have some of those local solutions.
Presumably though, Rachel, Dwyva, Meirionydd would have, you know, some similar types of issues. Is there some knowledge sharing to be done between us and them?
Yeah, yes, absolutely, and that really is the purpose of some of those collective groups and discussions, to be able to share some of those ideas and pressures. And as I said, you know, the franchise model, which is something that we're exploring, is an example of that.
Yeah, great. And are we exploring both sides of the border as well? You know, because obviously we share a long border.
Yes, absolutely. We work really closely with our other local authority areas. Shropshire is a good example. We have relationships already built, so we can call on local authorities to be able to understand some of those pressures and ideas. So yes, you know, because we are coterminous with England as well as other local authority areas in Wales. And that's an opportunity for us as well.
Yeah, absolutely. Yeah. David.
Just for clarity, Chair, I think it was mentioned earlier that there had been an uptake in the rate of the real living wage for us in 22-23, April 23. We didn't start paying the real living wage until June 23. So this is the first real impact we've had in that. National minimum wage obviously would have been being paid previously. We'd have accommodated that separately.
Okay. Thank you.
No, for care workers, the real living wage has been mandated. This is the third. This will be the third budget.
June 23, £70 million Welsh Government gave authorities in June 23 for the real living wage.
And what's the point you're making, Jackie?
It was 48p the first year. It was 90p in this financial year. And then next year it's £1.10.
Yeah, that was the national living wage increase. And then it went on to the real living wage in June 23, which was significantly more than the national living wage was set by central government.
For support workers, we've been paying the real living wage.
Was that something we chose to do or something that we were mandated to do?
No, that's something that we were mandated to do.
Okay, can you guys take that away then, just to confirm, just because I'm not quite clear on what's.
Yeah,
I'm not necessarily clear that it matters in terms of the questions that we've asked, but just I'm not clear between the differences of what you're saying. So if we could just park that point, because I don't think it needs to be deliberated anymore. But if you could clarify in writing afterwards, that would be great. Councillors, have you got any other questions on pressures? Chris.
Thank you, Chair. And that on there. Again, it's just seeking clarification. Again, one of the pressures in here is the workforce grant. Is it a 22% reduction of the 299, or is it was it 299 plus 22% that's been reduced down? Because that's not clear. And then my same points that I made within children's services still apply to this, I think, on the going forward, because this is a potential risk area, and I know it's been covered, so it doesn't need to have too much further clarity unless there's something different here. And then obviously with demography and aging population, you picked up that there's some pressures coming in there with increased demand. And then we're going around the new workforce pressure model, which you've got within Extracare, comes back to how is this then stacking up with the new transforming Powys agenda and making changes within the service, which are going to give us a bit more of a long-term stability of whatever model then materializes going forward. And I just wondered whether that could just be unpacked a little bit more to providing some additional reassurance in that sense that this picture that is being presented is sustainable and deliverable.
Thank you, Chris. Who wants to take those questions? Sharon, Rachel?
I'm happy to
Oh, well,
take...
the workforce grant question probably is Jackie, first of all. Jackie?
Sorry. The workforce grant is in the same way as in children's. They're fixed term posts because it's a grant, and we are looking at mainstreaming those posts or delivering in a different way. But we have now this last week had confirmation that there will be a 22%.
I think the question, Jackie, is whether that 299,000 is with the 22% reduction.
No, that was initially.
So
that's when we started
yeah.
the process, and those were the posts at risk, and that was the total amount. Now this last week or the week before, we've had confirmation that there is only a reduction of 22%.
So do we know what that new figure will be?
Of the 299?
Yeah, if we maybe just because that will need to be reflected on the budget papers, won't it? Or does it not, because it's held at risk?
This has been held at risk, isn't
yeah,
it?
no, that's fine. Okay, okay, then the next part of Chris's questions on the demography, who wants to take those?
I'm happy to take that, Chair. I think our transformation programme moving forward is all about actually managing those pressures by developing our preventative agenda. We work really closely to understand the numbers of people, the needs, where those needs are presenting, to make sure that we've got the right developments in the right place. And that is our programme of work. It's a long-term programme of work that involves, as Rachel has already said, the modernisation of domiciliary care and care homes and direct payments. And it's a whole system approach, working with colleagues in public health, the third sector and the health board to make sure that actually we're keeping people fitter and healthier for longer. And that is the focus of our work. It fits in with our place-based planning model and the locality model that I'll come on to describe on the next slides. And we're fairly confident that that work will allow us to meet the demands coming through. It's a difficult, and it's a difficult position with the issues around the marketplace and the workforce issues, because we no matter what models we have in place of delivery, we've still got to be able to staff it. So we're constantly working with our OD colleagues, with Workforce Futures, to make sure that our recruitment programs are as attractive as possible, and a lot of work goes into supporting individual providers in the market to sustain their workforce as well through training and support via the Scrutiny programme.
Rachel.
Yeah, just to add very, very briefly, and just to give a little bit of further context. So models such as extra care are essentially part of our Sustainable Powers transformation programme. And just to recognise the fact that it is a fine balancing act when you invest and create new models of service, and recognise that there might be some short-term pressures, which we've identified in the pressures, but actually longer term, this is a far better way of providing support to people. We know that we've got really good evidence base around extra care as a model of service in terms of keeping people at home longer, keeping people in their communities, investing in prevention, and actually that model of service, the longer term value of that is far more significant. So I just wanted to kind of reassure that extra care, whilst we're presenting that as a short-term pressure, is actually part of our transformation.
Thank you. Gareth, is that, sorry, Chris, has that answered your question to what you wanted it to get to?
It has, Chair. I think it's part of a journey that we're on, and it's also around the community education that we will need to do around resilience and looking at some of those things on there. And I know that work started, so that's helpful to see that that's being considered as a part of this process.
Thank you.
Thank you.
Gareth, I know you said you might ask it at the end, but we've got to the end of pressures for both children and adults now. Did you want to make an overarching question about the level of risk reserves?
Yeah, I've just got concern about it, Chair, about the level. It's 5.7, well, 5.8 million in social services. I didn't see anything in the general budget papers saying what the level of risk held at. The level of potential pressures being held at risk was. I know there's a £3 million provision for it, and I think there's another £1 million within the budget of I can't think what it said at the end now. And other pressures in future years, but I just wonder what the overall
and I know Jane's going to come in on this, and I think what it would be helpful, Jane, is obviously we've got a whole list of pressures held at risk here and also on children's, and that will be presumably in other services as well. Not that I've looked at all of those yet. Is there a way of putting them into a hierarchy as to what the biggest, most likely ones are that are going to require drawing down on risk reserves? Like is there a traffic light system that could be done, or some of these just being extra cautious? What's giving you concern about this?
Okay, well, if I can. So I think the first thing important to note is, in terms of my responsibility and signing off a budget for council to consider, I have to have a level of assurance about the level of risk in the budget, that the appropriateness of the estimates and the appropriate level of reserves that is held. So you will see in every budget report, you do have my commentary and my advice to council around that, and all of that is covered off. And I can confirm I'm comfortable with the proposal from that regard that Cabinet have proposed last week or the week before, sorry. Based on that assessment, we look at the whole budget as a whole. Any pressures that have already materialised or those that we are confident will be there are factored into that budget plan. Those that aren't that certain, we consider holding them at risk then against the £3 million revenue risk budget. So it's a budget line, not a reserve. It's an ongoing budget line. And for this particular year, we will be bringing out the Q3 budget report before too long, but we held about £5 million of risk this year against a £3 million risk budget. We are not currently drawing all of that £3 million budget as a result of those pressures, and the majority of those were identified against adult social care as well. So for this new year, factoring all of that in, factoring in the level of increase in council tax that's being proposed and everything, the proposal is to hold around £7 million worth of risk against that £3 million revenue risk budget. And based on the assessment that I've done, also considering the level of reserves that we hold as well, I feel that is an appropriate level of risk to move forward, particularly when we're looking at the increase we are on council tax, and we wouldn't want to necessarily, we have to be mindful of our ability of our residents as well to pay in that calculation and assessment as well. So it's on that basis we have that risk budget held.
So,
thanks, Jane.
Sorry,
go on, Gareth.
Yeah, just as that, so 80% of the potential risk is held in social services.
Yes,
yeah,
absolutely.
Yeah, okay, that's a bit I wanted to confirm, really, Jane. Thank you.
Right, okay.
Yeah, cheers.
I just want to push that point slightly further with the service though, because I know that the demography pressures that are held at risk, it's not that, from my understanding, and please correct me if I'm wrong, it's not that those risks haven't materialized, it's that they're there but we're not able to bring them into the service because of capacity issues with the work, with the placements and the packages. So again, okay, so that hasn't been brought in. If that same thing happens next year, then okay, there's more that hasn't been brought in. But is there a concern, Sharon, that at some point that will have to come in? And when it does, those people will have much more complex needs and requirements because they won't have been able to get the early help and packages when they first needed them because the packages weren't there. And so they're going to end up being over and above what we've estimated the risk being when they do finally come in. Am I making sense?
Yes, Chair, in part, you know, I think there is a significant risk around those people that we cannot meet their needs due to capacity in the marketplace. We do absorb a lot of that through our bridging team, but perversely, if we are successful in our transformation in creating capacity and improving the domiciliary care market, we will see increased costs in that area, because that's particularly where we see those pressures, that where we're holding people without a package of support. The plan and the focus is on reducing the need for the higher tier levels of support around residential and nursing care, which could offset some of that. But it is a huge risk, and it is, I think, Councillor Chris explained it really nicely, as a journey that takes time. So we've got to come at it from, I said before, without wanting to repeat myself, a whole system approach. We have to invest in our locality model and our place planning around prevention and increasing the resilience of communities. Working to increase the capacity of the marketplace will see additional costs, but hopefully they'll be offset in part by a reduction in the higher tier. There is, as you rightly pointed out, Chair, that elephant in the room, that if we're not getting to people, that they will have more complex needs. But that's where our bridging team comes in. So those people at most risk, we're meeting that need there. It's not a simple solution, and it's a mixture of efforts on different fronts, and it is a risk. It is right to point it out as a risk.
Okay, I think we just like to make a note, please, Connor, for the minutes, that this is something that we've said in terms of being noted of risk. So sorry, my words and thinking today have just all jumbled up after this week, but I think you get my point. Okay, right, ready to go on to cost reductions, please. And again, same point that I made for children's. We do have, I think, 3 impact assessments for these, but could you explain, please, you know, why there isn't an impact assessment for all of them? And also, could you please give an overview of where you think the biggest risks are in terms of achievability of these as you're going through them? That would be great. Thanks, Sharon.
Yeah, happy to do so, Chair. Similar to the conversation that Sharon Powell had with you, we have that overarching impact assessment, and then the specific ones for I think we've got 3 in our adult services. We're happy to look at any others that you feel that we should do, but predominantly they are either covered in that overarching impact assessment or the 3 that we've completed. I will run through them individually and give you an overview of what they are and the likelihood of delivery and any risks associated with each one. We have been, as I said before, we have undertaken various staff roadshows to identify any options and potential projects that we could be doing, where we could be doing things differently and be more effective and realise efficiencies. It is worth noting that we have a whole list of those, and some of those have longer lead-in times than others, so they will be being worked on throughout the next few months, and will probably impact on next year's rather than this year's. So the ones included here are the ones that we feel we can deliver this year. Starting with utilities, there's an efficiency target there. It's in line with the predicted reduction in costs from the energy companies. I'm not sure there's anything more I need to add on that unless there's specific questions. We've got a travel efficiency target. That's, although we are out and about more and we're seeing more people, and that's right and proper in the work that we do around assessments and support, there is an area of focus around making sure that we only conduct visits where we need to, that we plan our diaries accordingly so we can actually be efficient and not travel sporadically across the county, and obviously in line with our commitment to stronger, fairer, greener, we'll be sharing travel wherever possible. The mobile phone target, 10% reduction, that's already been realised, I think, ready. We've already identified those phones that are obsolete and don't need replacing. So I'll bring us on to older persons day opportunities provision. You'll all know that during COVID, a lot of facilities were put on hold. We're currently working through an engagement exercise, a really robust engagement exercise. I think there was 30 events, including an online survey and various face-to-face meetings, trying to identify what's important to people both now and future older people, to understand what a good life would look to them. And this information is being collated, and it'll work through to help us shape the future model. Estimates have been provided here for the remodelling provision. There's some potential to move some existing provision to partners facilities alongside an investment in home support as an alternative, and you'll see it's a part year saving because those proposals are yet to be finalised and worked through. Fairly confident that we can deliver that because the engagement work has been really positive, and don't see that as being a risk. The next one is around void management, particularly in the supported living accommodation for people with a learning disability. We've got various provision across the county. We sometimes have what we call voids in those accommodations, so vacant bedrooms where people move on. Sometimes people's needs increase and we have issues around compatibility. But what this target is around actually better understanding of the needs of people in relation to their accommodation, making sure that we're planning to make full use of the current provision, so we reduce the number of vacant beds, and we also plan for the future. So this is part of our ongoing work as part of our Closer to Home project, ensuring we understand the needs, as I said, of people now and in the future, so we can manage resources effectively and we're able to respond to need in a planned way. Reducing the number of empty beds and reducing the use of out-of-county placements. This programme delivered last year. It's an existing programme of work. There's a robust framework around that tracks needs and voids, and social workers and staff are proactive in identifying potential new tenants for any vacant properties, so we're confident that we'll be able to deliver this. This isn't around a reduction in service, it's about making the best use of what we've got. The next item is the extra care And as Rachel and I were describing around the pressures, extra care being one of our least restrictive models of support, a model that increases independence and reduces the likelihood of people needing more costly residential and nursing care. And this is an indication of the saving that we think we can realise with the extra care scheme coming online this year. It's part of that ongoing programme of work, and further efficiencies would be forecasted across subsequent years as that programme expands. The next line is transforming older people's accommodation. As you know, we've got a programme of work looking at older persons accommodation, and making sure that we're using what we've got efficiently and that we've got the right options in the right place across the county. And this is specifically a review of our building-based reablement service to ensure that we use that to its maximum capacity, and also exploring other options for future delivery. This will look to reduce the use of interim beds and costly out-of-county placements, and support timely reablement, so people can either return home or and be supported in their own homes, or move on to residential care but with lower level needs. This is probably the one item that we've identified as being the most at risk, I suppose, due to if we are to deliver and develop future different models, that has a lead-in time. It's quite complex, the work that we do in reablement around working with partners, and the demand is especially at this time of year, increased around our hospital discharges. So it's a key function and a key model of delivery, but it is quite complex in how we deliver it. We are obviously very aware of our commitment to deliver these efficiencies and to deliver our budget within the envelope. So if there is a risk there, we will be tracking that through the project group, and looking to deliver elsewhere if we felt that there was a risk in delivering that full amount. The next line is a slight anomaly, but needed to be included for clarity and transparency. This is the funding body review, and it relates to the 23-24 budget, and it's a reinstatement of the budget that was identified in 22-23 budget proposal, as that was only a one-off, one-year saving. So that money needed to come back into the budget this year. The redesign of the locality workforce, we've touched on this slightly as the theme of our place-based model. So this will involve developing local area coordination as part of our place-based approach, ensuring people get the right support at the right time in the right place. The proposal is to develop a locality approach in older person services based on a recent really successful pilot, embedding a new locality management structure across the teams. With feedback we've had is that the new team structure has increased management oversight, has supported staff to prioritise their workload, and has aided in the allocation of cases. This will include a review of the current structures, identifying opportunities for joint working, co-location, pooling of resources within the council and with partners, to develop that local area coordination. And in doing so, we're aiming to have a better interface with the community and the citizens of Powys, being able to build those networks in the community, build the resilience, and have better signposting. Also to have better information exchange to really understand what's going on in a community, making sure that we actually don't dive in to support people when there's already quite a resilient network of support within a community, but also identifying where communities are struggling, where we can best support them through our third sector colleagues to become more resilient. Obviously, the community connectors will focus heavily in that project, but the efficiencies will be made through better use of resources, cost avoidance, and managing the demographic pressures, as I just explained in the answer around the future models. The savings don't relate to frontline staff. There may be a review of management structures to make sure that we're don't have any duplication, but in essence we know that we can achieve more for people in Paris when we pool our resources, and that actually when we're in closer contact with communities, so we resolve problems at the earliest opportunities. The next line is around the strengths-based assessment process in domiciliary care. Again, this is an ongoing piece of work as part of the modernising of dom care programme. It involves the review of new and existing packages of care in order to ensure that people have the right level of support, that there is no overprescription of support, and with a focus on reducing care where appropriate, and decreasing the number of double-handed packages. We have seen an increase in the number of people requiring double-handed packages, and there's something that we're focusing on at the moment to review why that is. Is there any way that we could reduce that through technology or through training, so staff are more confident and competent? Obviously, there's a robust risk assessment processes around all of that. So it's not about actually removing care, it's about making sure that people have the right level of support, and we understand what that is. It could be that we identify that support can be provided through technology enabled care, and all of that takes robust assessment and engagement with the individuals that are receiving that care. We do know we've got significant demands in domiciliary care, and even though we're providing significantly more hours of support, and we're seeing more new packages of care, that demand is still outstripping capacity. So there is a need to make sure that we're actually using that resource as effectively and efficiently as possible. It's an ongoing piece of work. It has delivered previously. We have the framework around it, so we're comfortable that we'll be able to deliver on that. The next line is transforming and modernising the direct payment model. So this proposal seeks to further embed our direct payments offer and the development of pooled direct payments. So the aim is to grow the direct payments offer by making the system and the process easier to understand, and actually making it easier to understand what is a direct payment. By making the information and process easier to understand, people are better and able to make an informed decision about whether they would like to have their support needs and outcomes met through a direct payment. This would be achieved through really effective communication and co-production and engagement, leading to the development of an easy and accessible self-service options. We want to make sure that we're making the best use of the direct payments and enabling people to share their fund with other direct payment recipients to create a pooled fund. So where we have a community of interest, so people in a community that have similar needs and likes and desires, we can actually pair them together. Obviously, we take into consideration elements of risk and compatibility and people's choices. But it might be that people who are living in a remote and rural area where there isn't a level of community infrastructure, that actually they can pool their money together. An example of that could be if there wasn't a local exercise group, especially those focusing on adapted exercise, so armchair exercise or gentle movement. People could pool their direct payments together, hire an instructor, hire the hall, the venue, and have that activity that would meet their needs, that could also be opened out to members of the public. This needs to be supported, absolutely acknowledge that, and that can be done through our internal staff, day service staff, but also through our community connectors. So that's just a very brief and broad example of how that can work. Elsewhere in the country, people pool their direct payments in a project called Exercise Buddies and Gig Buddies, and form a pool of support networks to be able to go out to see concerts and gigs and theatre where they want to go out as a group and socialise as a group. So instead of individuals all doing their activities individually, you create a community, and actually then you see a reduction in the cost of that direct payment, but also you free up the personal assistance in that area. We know it's very difficult to get personal assistance in some localities and in general, so that we do need to focus on increasing the number of personal assistants that we have available for people to engage with, and this is one of the ways that we can do this. It was a government initiative a few years ago with some pilot areas identified, so there's lots of learning already out there of the effectiveness of this. We have a strong record in Powys in promoting direct payments. I believe we still are. We have the highest uptake in Wales. Engagement with direct payment recipients show that they are a key means of helping people decide how they can meet their own care and support needs, and one of the most autonomous ways of achieving outcomes. Again, an ongoing piece of work with a very sound evidence base, and we're happy that this presents a low risk in delivering on this. Reducing the voids in learning disability respite, similar to the children's services. So we have a range of provision across the county. They don't always operate at maximum capacity, so we have voids, and what we are seeking to do is actually reduce the number of voids that are present, make so that it's an efficient use of that service, and also to review whether there are alternative ways of delivering that respite for carers. Sharon gave an example. There's also examples of support through daytime occupation rather than overnight respite options. So again, important to assure that this isn't looking at a reduction in provision. It's making sure that we understand what people's needs are and making sure that we're using the current provision as effectively as possible.
Just getting slightly conscious of time, Sharon, because we've got about 25 minutes left of the meeting, and I know members are going to have questions. So if we could just go through the next ones quite quickly, if that's all right, please.
Absolutely. Oh, sorry, Chair. So the next one is increasing the number of shared lives carers. So shared lives is a model of support where people are matched with hosts, and they will go and live within their home accommodation. One of the most, one of the least restrictive support options we have, and one that actually maximises people's independence and community inclusion. We're aiming to increase that service through robust recruitment processes being supported by Shared Lives Plus and examples of other very successful recruitment programmes across Wales, and with the view that with more capacity in Shared Lives we'll be able to reduce the uptake of residential packages and more costly out of county options. The change in accounting presentation of deferred charges and the provision against the deferred charges is something I will need Jackie to help explain to you. Jackie, if you're able to do that.
There was a recommendation by WAO to look at how we're accounting and the presentation of deferred charges. Within the council, we only raise the invoice when we have assurance that the estate or the person has sold the property and is able to to pay. So that's why we've been prudent. And although there's 1.4 million that we could invoice for, 1.2 would be at risk, but we do feel that we could increase our income target by the 200k, and that would be achievable in the next financial year.
Thank you, Jackie. And the final line, there is a repeat of last year's, which is the ongoing focus on working with the health board partners to ensure that costs for supporting adults is appropriately funded where there are health needs clearly identified.
Okay.
So that,
and then you've got, is it just one last slide which says the overall budget position?
Yeah, so that's the total increase in the budget is the 8.618 with a final budget of 89.282, which is an increase of 10.7%. I think at that point it's important to note that we are aware of the significant spend in adult services, and it is always at the forefront of our mind of making sure we make the most effective and efficient use of that, and that is certainly why our transformation programme moving forward has to be focused on the preventative agenda.
I think that we've been able to clearly see why that 10% and where that's come from in terms of the contractor provider uplifts in real living wage. So thank you. Yeah, if you could go back to that slide. Right, members, we have got about 20 minutes to ask questions and get through the rest of this. So have you got any questions on the impact of these cost reviews, cost reductions? Anything you'd like clarifying? Any concerns you've got? No hands. Okay, right. Well, I will kick off just quickly with questions. Or Gareth's put his hand up now, but I'll just ask a couple of questions on the travel efficiency target and the mobile phone target reduction. I know you said in relation to the mobile phone one, you've been able to identify phones which weren't needed. Obviously, £4,000 is a lot of phones. Were they just not being used, or are they using them in different ways? And equally, the £10,000, I know it's a drop in the ocean of the budget, but if you do that based on per mile of expenses, which is what's the miley, is it 35p, 40p? 45p. You know, that's a lot of miles. So why is that reducing? Why is there not an impact assessment? Is anyone going to be visited less? How have you calculated that in a way that is ensuring that residents' needs are met?
Can I ask Jackie, could you just explain how that was calculated, and then I could come back in on making sure that people's needs are met?
The travel efficiency has been calculated based on an underspend in this year and a push next year, moving into the locality model. And the mobile phones, there was just positions that no longer needed a mobile phone. Some had come on board during COVID when we were starting to do outreach work, but they're now back based in buildings. Also, there's been a move to actually using your own phone for work purposes. So there's no need for the large number that we did have in the service.
Okay.
And they've been decommissioned recently. So,
but in terms of the mileage, I think we're looking at over 20,000 miles. Is what are there any comments to add about, you know, the impact of that?
I think as Jackie said, that, you know, it's based on the trend that we've seen. Okay. The impact, I mean, if we need to see people, I reassure you we would be out there seeing people. The focus on the locality model and the ways that we've been changing how we operate has been around actually being present in a community where people congregate, so there's less individual travel, so we're seeing people more often, more regularly, building relationships, so there's less need for that ad hoc emergency dash, which allows us then to continue to respond when we need to, and obviously there is always we always have to go out and see people in situ to build relationships, to understand their needs, and also to manage risk. There's certain functions we can't perform remotely, assessing mobility and aids and adaptations, but the new ways of working around teams and meetings, and our kind of corporate function of around meetings means that we do less travel because we're using Teams. So we're actually, the travel we do is focused on interaction with people.
Okay, thank you. Rachel, did you want to add to that?
Yeah, I just wanted to say that as part of our transformation work as well, we're also exploring trusted assessor models. And by that means that we would be using other roles and other organisations and agencies to undertake some of that work on our behalf. An example of that is working with domiciliary care providers as part of our programme of work, where they identify increases and decreases in packages of care, and making sure that we've got systems in place to be able to trust that assessment, as opposed to having to undertake a social work assessment. All of that contributes to using our capacity in a better way and being smarter and more efficient, and also working with health colleagues in terms of that trusted assessor model as well. All of that adds to utilising our capacity in a better way and reducing our travel costs.
We've also, if I could come in here, we've also been really conscious in our efforts around managing our workforce around patch-based working. So reducing the need to travel to an office and back out then to visits. So people are actually travelling closer to home as well.
Thank you. Shan?
Just to come in anecdotally as well around how travel is reduced when you go to a patch-based model as well. So I had sort of first-hand experience of that as a frontline worker. When I first joined the last team I worked for, we worked all over Gwent. And we would always try to coordinate home visits because we went out into the community. All of our work was done out in the community with young people, but it was one-to-one work. So you try to coordinate so that, you know, all the people that you've got that happen to live near Chepstow, you would do on the same day. And it's really hard to do that because you've got to be flexible around their needs, what's going on for them, what comes up in their life on that day, etc. But then we moved to a patch-based model, where I was just really in Blaenau Gwent instead of all over Gwent. And even those calls where the young person cancels at the last minute or you have to rearrange because something comes up for them, it still massively reduces the travel because the overall radius that you're travelling within is so much smaller, makes a big difference.
Okay, thank you. Thank you for answering that. Councillor Gareth.
Yeah, apologies, my hand keeps coming up and down. I don't know what's wrong with my machine. I was going to make another point, but I'm going to start with the point that Rachel's just made about the trusted provider. I think that's a really, really good idea. And I was speaking to somebody who works supporting another service in a pub recently, and he told me that he thinks it takes 6 different people to involve from when the client raises an issue until it comes to him as the member of a company to go out and do the work, where he could actually go and do the work himself. So I think that's a wonderful model that we should be looking at rolling out across the county. And obviously that then has a saving on staff time and make it more productive. The question I wanted to ask is around the funding body review, the £1 million there. How confident are we that that is a £1 million ongoing reduction in our costs that could be achieved?
Thank you. Yes, very confident. We've already identified individuals. We've got a programme of work around it. I meet with the health board and their complex care their team and our CHC team, and that work is already in part in progress.
Thank you. And just to say, Chair, I've got to dip out in about 8 minutes' time. So
Does that mean you're gone, or are you dipping and then returning?
no, it means I'm gone.
Okay.
Because I've got another meeting, but I will send you the notes I've made.
Thank you very much, Councillor Gareth, for your contributions. Okay, the day centre one, day opportunities one, sorry, 120,000. How did you come up with that figure given you're partway through the process? How was it calculated? Because presumably you're still reviewing the consultation and engagement that's been done. I don't know who wants to answer that.
You're absolutely right, Chair. This is an ongoing piece of work, if I remember rightly, this was a figure that was identified in a paper last year, and it was looking at the modelling regarding existing resources and potential options. So that figure could change. But it was actually looking at the current resources that we have, current uptake, and having already been working with people quite closely previously, having a kind of a rough idea about where the demand is and what people were indicating they would like. That's how the modelling was done. So it's an indicative figure, and you're right, it could change throughout the process.
Rachel?
Yes, I just wanted to support that. That figure has been based on previous modelling options, but certainly is not set in stone in any way. It is an exploration of a range of different ideas, such as the use of extra care provision, residential care accommodation, looking at the utilisation of home support and local area coordination, the increase in accessibility around some of our universal services, the things that everybody has access to. Sharon's already talked about the pooling of direct payments and how that creates an offer. So it's a combination of all of those, without actually making any assumptions around the conclusions and recommendations of the daytime opportunities report, which will provide a lot more detail and actually may create further efficiencies in terms of when that's finalised. So those are just indicative figures.
Okay, so if the pre-COVID status quo is returned to, would that 120,000 still be projected? If you were to go back to the model of day opportunities you had previously?
Sorry, can you repeat that question? Just so
If
I
you
understand that.
So if the outcome of the engagement exercise is sort of not to change things and to go back to what you had before COVID, because I realise we're in this transition period, aren't we, where day centres are closed during the pandemic and things haven't gone back to what they were like before. But if the outcome of your engagement exercise is to go back to that, what assumptions have you made to be able to calculate like 120 applying to any of the options going forward?
I think as the engagement exercise has taken place, and we're just currently writing up the findings of that. So we've had ongoing feedback, and it's highly unlikely that there will be that exact request to return to exactly what it was. Some people have already taken up different options within the community, doing different things. So it's highly unlikely that we will, without wanting to predict, but it is highly unlikely that we will see an exact replica of what we had before, just because people have moved on and want different things.
Demands are very different, aren't they? Very different.
Yeah.
Okay. I think it would be helpful to have some detail on how you've calculated that, just because
Absolutely.
This is I'm going to use the word journey like we've used before, but you're partway through this, and as a service you need to be really transparent as to how you've calculated that, because it's quite an emotive topic.
Absolutely.
So I just want to make that point really. If Connor, if you could make that clear in the minutes as well. Sian, did you want to add?
Yeah, mindful of time, and I hope I won't go on. I think it's really important to make the point that using the strength-based approach, and we talk about having conversations with people, asking them what matters to them and what's important to them, and that's the framing. So we're not asking people to say, what would the right services for you look like? We're asking them to tell us what a good day looks like for them, what a good life feels like for them. Aware all the time that, you know, essential components of well-being generally, it differs slightly across people, but essential components of well-being are a sense of independence, a sense of being in control of our own lives, enjoying where we live, having connectedness, feeling that we belong, feeling that we've got some purpose. So the exploration is much more around what makes that happen for you, and then using that data and that intelligence and that understanding about individual different people's good days and what they look like, how we then work with partners with the assets that we've got, with the assets that they've got, with the strengths that people already have, with the networks that are potential for them in their communities. And community could be community of place, the place you live, or it could be a community of interest. You know, different people are interested in different things. Bringing all of that together, so that together with people and with our partners, who are also, you know, people are our partners as well, but third sector, health board, community groups, looking at all of that in the round, how can we make sure that there is a patchwork of resource and opportunity available to people that in one way or another meets people's needs differently. So different people are going to want different things, but as long as the patchwork is big enough, together we can make sure that there's a range of opportunity available to people that will tick those boxes that make what a good day looks like to them. So asking people what matters to them isn't us saying, tell us what you want and you'll get it. We will do what we can to give you that specific thing. It's much broader around, if this is what a good day looks like to you, if this is what well-being means to you, then how can we work together to make sure that you have well-being? So it's creative.
Yeah, and it's it could be coming back to scrutiny, and you know, we'll be able to see what the response is to that consultation, which is absolutely what we want to do before you are making decisions in this area. So we want to look at, you know, how it's shaping things. Just moving on slightly then, the redesign in the locality workforce and the place-based model. Do you think this is something that we should have on our work programme to come back to see how that goes and what it looks like, and also whether or not that kind of model could be applied to children's? Is that something that...
Absolutely, yeah, I think, yeah, absolutely on the work programme. You know, it is going to be the focus for the next, you know, next few years, and it's a huge, it's our underpinning philosophy, I think, around place-based planning. So it's going to be critical.
Yeah, okay. Can we make a note that then? That's a recommendation for us to put it on our work programme. And then on the direct payments model, again, this is something which is already in our work programme and will be coming back as you're carrying on with that modernisation. In terms of where you say about pooling resources locally, and you used some examples of what that could mean. How have you factored in how you'll get that intelligence?
Yeah, well, that's something that that we do need to deliver, that framework around gathering it. Some of the ways that we'll be able to do it is through the new direct payment service, but it's also around collecting that information via the social work teams around any gaps in provision, our community mapping, and I'm sure Rachel's going to come in and tell you more about the new model of delivery.
And is there going to be a system that has all of this intelligence in it in terms of local support and offerings? Rachel, I'll I'll shut up.
Yeah, I was just going to say that we have put together a collaborative forum working collectively with the third sector organisations, PAVO and Health, to share intelligence. There's a huge amount of work being undertaken through our health colleagues in terms of what's called the Accelerated Sustainable Model, the Frailty Working Group. PAVO have a huge amount of information collected through their community connectors. And the collaborative forum is the opportunity to look at a granular level in terms of each locality around what currently is in place, what's working, and what are the gaps. Because there's always a danger when we try to look at prevention opportunities and coordinating that offer, that you undo or undermine some of that good work. So that's the opportunity behind this new prevention collaborative. And I, you know, what I would say is it's actually working really well. We've got a really good terms of reference in place. There's a real strong commitment. And actually the value and the local intelligence that you get from that information is hugely valuable. So that will be a pivotal forum for us to utilise in terms of developing that locality model.
And that the local area coordination will need to build in that, exactly as you're saying, Chair, that ability to capture that intelligence, a bit like the time banking model. So understanding where the gaps are and where the options are to offset those gaps, and that's something that we'll be looking at building.
Cool. I look forward to hearing more about that. Sorry, I've still got a couple of questions left on the reduction in voids in learning disabilities one. I think you've alluded to the fact that although there's no reduction in capacity, that there could be a impact on choice. So my question is, how come there's no impact assessment reflecting that, and what is that impact on choice?
I think we don't know as yet what that review will lead us to, and I think the initial focus is reducing the managing the voids better, and then we'll be able to review what future delivery model we need, what that looks like, and absolutely, if there is a reduction, then we'd be completing an impact assessment. The only thing that I think we talked in our pre-meet was around the fact that if we are using the services more effectively and filling the voids, there may be less flexibility, and that's something that we'd have to understand around the impact that would have on families, that flexibility.
So an impact assessment will follow in due course then, as and when you get to that, will it?
Yeah, if there is an impact, yeah.
Okay. And then I think it might be my final question. Just the one on the shared lives carers, which supports independence. What is there a risk associated with increasing the level of independence that these children, are they people that have come into adults, so they're young people that have this support? Am I right? They've recently transitioned, or is it all adults with learning disabilities? Okay,
all adults. So there's also a focus on actually expanding the offer into other population groups as well.
Okay, so is there a risk associated with increasing the level of independence that people may have here? And is that something that people want? How have you gauged whether, how have you gauged why this is a good change in direction?
Okay. Well, I mean, nationally, the shared lives model is recognised as an exemplar model of support, especially as you said, around supporting people with learning disabilities. We have great feedback from our existing cohort of people and the impact it's had on their lives, and it isn't always about increase in independence. It can be around just that stability that family environment can give, that is kind of more responsive and flexible. So in short, to answer your question, the model of support is well recognised as being an effective and appropriate model.
Okay.
It is something we are at capacity, and the outcomes for people usually in shared lives is that actually they don't end up actually, as they get older, needing to come into building-based higher cost residential care. The family continues with that level of support.
Okay. Sounds positive. Sian?
And just to say, obviously, I mean, I'm sure you know this, but, risk and the assessment of risk is an ongoing process in any kind of care and support that we do with anybody. So we talk about assessments with a capital A, and that's like a formal assessment that's a specific stage of the process. But anybody working with anybody with care and support needs is continuously assessing risk all the time. Anyway, it's part of the job. So shared life carers will, they get training and they get support to be able to do the job ongoing, because it is a job.
And it's a regulated service, so it's very robust around its risk management.
Rachel?
Yes, thank you. It's just making a very similar point, really. And it was on your question in relation to voids and choice. And it was just to make that point that, we, as part of a social work framework, there's a very rigorous best interest process in place. So that is essentially the impact assessment, which is embedded in social work framework, that will look at people's choices in a very supportive way, ensuring that people's best interests are absolutely at heart. So that in itself is an impact assessment. So where we are enabling people to make choices, it is around their best interests and being supported to do so. So just wanted to provide that assurance around that.
Yeah, thank you. Sian, you've still got your hand up.
New ones, sorry, just one final thing. And I think it's also important to note that all of this stuff is nuanced. So in terms of learning disability respite provision, so if there was a particular building-based respite that the carers of a particular young person with care and support needs were used to booking once a year, for example, for their respite, and because we reduced the number of the amount of building-based provision, it might be that building that they wanted was booked up at the particular time that they wanted it, because of the provision being slightly reduced. That would reduce their choice in that sense, that they couldn't get it the week that they wanted it, maybe. But on the other hand, we're reviewing how we assess people's needs for respite, and that will become more creative and more bespoke to what that person wants. And it might well be, we find quite often that when you actually ask those what matters conversations and start looking at, well, what would good look like for you, the things that they actually really want, if they're allowed to have what they want, can often be much less than you would have thought people wanted. They might want something much shorter in provision but more regular, or they might want to do something that costs a lot less money than the thing we've been used to providing. So it balances out in the long term when you start giving people more choice.
Thank you. And there is, sorry, I did turn my page and just saw one last question is about the last line on it, which is the review of provision of continuing healthcare. Is do you feel that is achievable, and is that how have you calculated that? Is that based on certain individuals that you're aware of?
Yeah, as I responded to Councillor Gareth, yeah, this work is an ongoing programme of work. People are identified. We've got a system around it. We've already got those regular meetings reviewing, and those conversations are already happening.
So you're confident from that then? Yeah, good. Any other questions from anyone else? No, thank you. Okay, I think we need to take stock potentially offline of what all of our queries and recommendations have been, just to see if there's anything that we wanted to follow up on, because it's been a very long morning. So I'm going to try and do that over the next or this afternoon and the next day or so with Conor and Councillor Gareth. But I think that completes our scrutiny of this. So thank you very much, all of you, to coming today. Thanks to the portfolio holders, and Jackie, you've had to do both adults and children, so well done you, and deal with me and Gareth last Friday as well with all of our questions.
That's fine, thank you.
So thank you. I always appreciate your time and your candor with all of our questions, and I appreciate sometimes it's down to my sort of lack of understanding of how things work operationally. So thanks for answering all of my questions. Nina, anything to add as you've been sitting in the background?
No, I'm just a thank you to Sharon, Rachel, Jackie. You know, really well done, and thank you for answering all the questions, but also a thank you to you, Chair, and the Scrutiny Committee. You know, we get a lot of value from coming and talking to you, and your questions are always so insightful. So just thank you for all of your kind of challenges and questions today as well.
Thank you. I know, Conor, we've got the minutes and action log, which I parked to the end. I'm going to have to make a confession that I haven't actually seen those minutes on the agenda. I think they were in a supplemental one, and I possibly reviewed them back at the time, but haven't reviewed them in these minutes. Is it something that we can park for the next meeting?
Yeah, no, that's fine. That's fine.
Okay, we're not. And is there anything else that we need to discuss today on the agenda, Conor?
I think that was everything. I think it's all been covered now.
Oh, there we go. Yeah, I've got everything. Okay, I think then if Conor and Gareth will send through what he's written down, I'll have a review, and then Conor, could we touch base to see whether there's anything we think as a committee we just might want to clarify? And councillors on the committee, thank you for thanks for your time today, and please send through any queries that you have over the next day or so, because this is going to Cabinet on the 6th of February, so we need to get the comments and recommendations all wrapped up quite quickly. And on that note, have a lovely weekend, all. I'm sure everyone could do with a great weekend this weekend and a bit of a chill out.
Absolutely. Take care, everyone. Thank you
all.
very much.
Bye, everybody. Bye. Bye.
Oh, Conor, do you want to just stay on once you've come offline just for a quick second?